All right, so question number 1. Which of the following is considered a normal adult respiratory rate? Is it 10 to 20 breaths per minute, 12 to 20, 20 to 30, or 30 to 40? You have to know your normals, and you notify your nurse anytime something is abnormal outside of the normal parameters. So I'll give you 5 seconds because this is an easy one. So 3, 2, and 1. And yes, if you chose B, you have it. That is correct. So the normal adult respiratory rate is between 12 to 20 breaths per minute. Anything below or above this range may indicate respiratory distress. Question number 2. A patient's blood pressure is recorded as 88/56. The mmHg stands for millimeters of mercury, or how much pressure. What is this patient experiencing? Is it A, hypertension, B, normal tension, C, pre-hypertension, or D, hypotension? And we'll reveal the answer in 5, 4, 3, 2, and looks like Mirtha and Danita, you have it. Yes, it is D. So a blood pressure below 90/60 is considered hypotension. This may indicate a need for further evaluation or intervention. Question 30. When measuring a patient's temperature orally, which reading would be considered a fever? Is it 97.5, 98.6, 99.1, or 100.4? Which is considered a fever? All right, revealing the answer in 5, 4, 3, 2, and Mahima, I see you. You got it correct. It is D. So I know you all wanted to choose the one that was in the 99s. But technically, depending on where this person's from, what part of the world, a temperature of 99 may actually be okay. That's not indicative of a fever. So the answer is D. A fever is typically defined as a temperature of 100.4 or higher. If it's in the high 99s, we're still going to monitor it, but we don't necessarily call that a fever just yet. Question number 4. What is the critical action if a patient's pulse is irregular and below 50 beats per minute, indicating bradycardia? Do you want to A, wait and recheck after 10 minutes, B, encourage the patient to lay down, C, inform the nurse immediately, or D, offer the patient water? You spend more time with those patients than the nurses. So if your patient has an irregular heart rate as indicated by you feeling their pulse and it doesn't feel regular and the heart rate is less than 50, what do? All right, I will give you 4 more seconds. 3, 2, and I see you. You all have it right. That is right. You got to get that nurse in the room. The answer is C. Bradycardia, which is when the heart rate's less than 60, is a critical sign that must be reported to the nurse immediately, especially if the pulse is irregular. So great job, team. Question number 5. A CNA has taken a patient's radial pulse and counts 120 beats per minute. This is an example of, is it A, tachycardia, B, bradycardia, C, normal pulse, or D, hypotension? And we're moving fast. You got 12 patients today. You got 12 rooms. You're in and out. You're doing all the vital signs. What do you notify? When do you notify them? And so if a patient's heart rate is beating 120 beats per minute, that means that they have A, tachycardia. So Ranita and Jerlyn, you have it. Tachy is when it's higher. It's faster than it's supposed to be. So tachycardia is a heart rate over 100 beats per minute in adults. Because remember, children have faster heart rates. So in children and infants, sometimes their heart rates will be higher than 100, and that will be normal for that population. It's not normal for adults. Hey family, guess what? We are this close to having 1 million, 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. Question number 6, everybody. If a patient has a SpO2 level, that's the oxygen saturation, of 88%, what is the appropriate next step? A, continue monitoring. B, ask the patient to breathe more deeply. C, report it to the nurse. D, place the patient in the prone position. Giving you 5 more seconds. So 4, 3, 2, you go into the room, the O2 sat is 88%. Do you tell them to breathe more deeply? No, you do not. You press that button. It is C. You get the nurse in the room, because an oxygen saturation level below 90% may indicate hypoxia and should be reported to the nurse immediately. So after you press that button, then you can sit them up. You would not be putting them in the prone position. You would be putting them into a semi or high Fowler's position. Question number 17. Which of the following is considered a critical high systolic blood pressure that should be reported? And I expect everyone to get this one right. So is it 120, 140, 160, or 180? Revealing the answer in 5, 4, 3, 2, and I don't see any answers yet. Let's see, maybe my computer's going slow. There we go. Now we have answers coming through, and you all are absolutely correct. You chose D. So even though the others may be indicative of hypertension, the one that requires the immediate attention is the one whose blood pressure systolic is 180. When we're approaching 200, that is a critical reading. We say that person's at stroke level. So a systolic blood pressure of 180 millimeters of mercury or higher is considered hypertensive crisis and requires immediate attention. So we got to get those pressures down. Question 8, a patient's normal body temperature is recorded as 102 degrees Fahrenheit rectally. What term describes this condition? Is it hypothermia, pyrexia, bradycardia, or tachypnea? Oh, you may have to Google search this one. So I'll give you 10 seconds. Let's see if you can get this one right. So 9, 8, 7, 6. It's like the countdown for the new year. 5, 4, 3, 2. I don't have a correct answer yet, so I'm revealing the answer right now. Yes, Stella. Yes, Lady E. It is pyrexia. So the answer is B. Pyrexia is also known as a fever, or it relates to an elevated temperature. So even though you may not hear that word used a lot in common days, it still means that a person has a fever. So great job, team. Question number 9. What is the normal pulse range for an adult patient? Is it 50 to 70 beats per minute, 60 to 90 beats per minute, C, 70 to 90 beats per minute, or D, 60 to 100 beats per minute? Can't trick any of you. I see all the correct answers. So now, Ballet, I can't pronounce your name. So I'm going to get it right the next time, though. I saw you. You have the correct answer. So it is D. It is 60 to 100 beats per minute. That is the normal adult pulse rate. Let's go to question number 10. And this one is a scenario. And we have a lot of scenarios. So stay to number 40, and you're going to be challenged today. I like this test. So our scenario team. You have a 67-year-old patient who reports shortness of breath and fatigue with minimum activity. Upon assessment, the CNA notices the patient has pale, clammy skin and rapid, shallow respirations. So here's the question. Which abnormal vital sign is most likely associated with this patient's symptoms? Is it A, a blood pressure of 140/90, B, a heart rate of 120 per minute, C, respiratory rate of 38 breaths per minute, or D, oxygen saturation of 95%? I give you a few more minutes to look that over. I'll give you at least 30 seconds, and then I had to star Layla's comment. Layla, I am so proud of you. I will show your post in one moment. So everybody revealing the answer in 10 more seconds. This one was a more complicated one. So the person has pale, clammy skin, rapid, shallow respirations. Which of those abnormal vital signs would most likely be associated with that patient's symptoms? And let's see. We have a lot of, we're torn between C and D. And if you chose C, you have it. Oh, she is hyperventilating. Her respiratory rate is 38 breaths per minute. That's way above the normal of 12 to 20. So a respiration rate of 38 beats per minute is abnormal. It indicates tachypnea, which correlates with the patient's symptoms of shortness of breath and fatigue. Although an elevated heart rate might also be present, the respiratory rate directly explains the primary symptom. Remember, the primary symptom was the rapid, shallow respirations and that pale skin. She's not getting enough oxygen. She's pretty much just overloaded with CO2. So everybody, let's go ahead and give our wonderful Layla applause. Congratulations, Layla. So she says, Happy New Year, Eunice. I passed my written and skills test on my first try last month. Hey, your practice test videos and practice questions kits. Oh, thank you so much. You bought it through Amazon. Helped a lot. You are so welcome. And I look forward to helping you on your journey towards nursing school also. All right, so everybody, let's go to our next question. Question number 11. Which of the following vital signs is considered life-threatening and requires immediate intervention? Is it a temperature of 101.3, a pulse of 62 beats per minute, a respiratory rate of 8 breaths per minute, or a blood pressure of 130/80? Which requires immediate intervention? The way I like to think of it is which is above your CNA or PCT pay grade. The one where you're like, I can't deal with this today. Let me get this nurse in the room. All right, so revealing the answer in 5, 4, 3, 2, and that's right, Kaywan, Chrissy, Merlin, Kelly, you have it there. It is C. That respiratory rate is too close to 0. So a respiratory rate of 8 breaths per minute indicates respiratory depression and requires immediate intervention. If you don't do something soon, you're about to start CPR on this patient. Question number 12. A patient's diastolic blood pressure is measured at 110 millimeters of mercury. This is classified as hypotension, normal, pre-hypertension, or D is hypertensive emergency. So the top number, the diastolic number, the bottom number is 110. What does that mean? All right. And I was doing this late at night, so I hope I have indicated the correct answer on the next slide. But if the diastolic pressure is 110, not the top number, diastolic is the bottom number. So what's the range for the bottom number? Yes, K. Wong, and yes, J. Lau. So regardless of what I have on this next screen, because I did this late at night, we have it there. I have the right answer. It is D. So a diastolic blood pressure is usually 50 to 80. So if this person's pressure is now 110, that is a hypertensive emergency. It should be reported immediately. So remember, the systolic, according to normal standards, I'm giving you a few answers here. I'm not going to talk them out because this is going to help you with a future question that's on this practice test. So look in the chat. All right, so here we go, everybody. Question number 13. A CNA has taken a patient's pulse and notices an irregular rhythm. What is the appropriate next step? A, recheck the pulse in 1 hour. B, report the finding to the nurse. C, ignore it if the rate is normal. Or D, document it as normal. Forgive the typo. All right, you're taking a patient's radial pulse and it's irregular. What do you do? And that is right, everybody. It doesn't hurt to let the nurse know because this could be a change in the patient's heart rate. An EKG may be needed. So it is B. An irregular pulse can be a sign of an arrhythmia, which should be reported to the nurse right away. Question 14. If a patient's heart rate is 45 beats per minute, which condition might they be experiencing? Is it tachycardia, bradycardia, normal heart rate, or hypertension? Oh, we're learning new terminology because when you get your first job, I want you to be aware of all these medical terms when people are talking around you. So it's not just that the person has a heart rate of 45 beats per minute, because it's not going to say that as a diagnosis. What will the diagnosis on the chart? What will the doctor actually write? And if you chose B, bradycardia, you have it. So tachycardia is when it's fast. Bradycardia is when it's slow. Brady means slow, cardia referring to the heart. So bradycardia refers to a heart rate below 60 beats per minute. Question number 15, team. What is the critical first step when a patient's SpO2 reading falls below 90%? Do we A, administer oxygen, B, recheck the pulse oximeter, C, reposition the patient, or D, inform the nurse immediately? Gladys was fast with this one. Gladys has D. Let's see if we have any other responses. Merlin says D. We're waiting for 5 responses. Kelly Nalubega, I said it, says D. Let's see. Jacoba says B. Barefoot Warrior says D. So everybody says D, and you have it right. It is D. Low oxygen saturation below 90% requires immediate intervention. So reporting to the nurse for further evaluation is warranted. Don't forget to sit the person up while you're waiting for the nurse to come into the room. But the first thing that you would do would be to notify that nurse. Question number 16. A patient's blood pressure is measured at 200 over 120. What condition does this indicate? And I should have drilled this in your head by now. Is it a normal blood pressure, hypotension, hypertensive crisis, or tachycardia? 200 over 120. That is right, everybody. So there is hypertension, but then there's hypertensive crisis. So a blood pressure reading of 200 over 120 indicates a hypertensive crisis, again, requiring immediate intervention. So why is this important? Because you all spend more time in the room than the nurses. So you are the one in there getting the vital signs. You need to know when to notify the nurse to come into that room. So question number 17, a 52-year-old patient reports sudden onset of chest pain, radiating to the left arm and nausea. The patient is diaphoretic and appears anxious. Question, which abnormal vital sign is most likely associated with the patient's symptoms? Is it a blood pressure of 160 over 100, a respiratory rate of 16 breaths per minute, a heart rate of 60 beats per minute, or an O2 saturation of 98%? Got you thinking. A lot of you all are pre-nursing. You're doing CNA so you can become a nurse. And so while you're in that hospital, you got to be learning. You're monitoring. You're looking at these patients. And this patient has chest pain that radiates to the arm. Their nausea. You do the set of vital signs. Which vital sign is most likely associated with that patient's symptoms? And if you chose A, great job. This person is having cardiac issues. So an elevated blood pressure is a common finding in patients experiencing acute chest pain. Remember, pain causes the vital signs to increase, including the blood pressure and the heart rate. So possibly due to cardiac event like a myocardial infarction, aka a heart attack. The high blood pressure is a response to the stress on the cardiovascular system. While the other vital signs may remain within normal limits, the elevated blood pressure is most relevant here. So patients having cardiac symptoms, chest pain, blah, 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 you're going to get the full set of vital signs. And in most instances, you're going to see that the blood pressure is abnormal. Question 18, which of the following SpO2 readings is considered life-threatening? Is it A, 94%, B, 92%, C, 88%, or D, 98%? And you can't choose all of the above. That's not an option. Because your patients are not normal. They are not textbook. So I need for you to know when to panic, when to get that nurse in the room right away versus, all right, well, this is her normal. This is where she normally sits and her nurse is aware and we're okay with that reading. So everybody reveal the answer in 5, 4, 3, 2, and you all have it. It is C. Come on now. We're not going to let it drop below 90% and let it just stay there. So usually your nurses have parameters. If a patient has COPD, their O2 sats are usually around 95, 96%. So that's just normal for them. So if you go in and O2 sat is 94%, you're not freaking out. But if you go in there and now it is 88%, that indicates hypoxia or hypoxemia, and you need to go ahead and get your nurse into the room. Question 19. A 25-year-old presents with a high fever, chills, and lethargy, meaning that they're hard to arouse. The CNA notes flushed skin and reports that the patient appears confused at times. Which abnormal vital sign is most likely associated with the patient's symptoms? Is it a blood pressure of 110/70, a temperature of 102.5, a respiratory rate of 18, or O2 sat of 96%? Flushed skin, confused, high fever, chills, and lethargy. So the answer is actually in the scenario. So yes, Jacobus. Yes, Jerling. Let's see. Nalabiga, Chrissy, Najeru, you have it. It is B, that temperature. Just letting you know that this patient's not doing well. That high temperature indicates fever, which is often associated with infection and could lead to symptoms such as chills, lethargy, and confusion, especially in older people. If they get a UTI, urinary tract infection, oh my God, they're going to be so confused. So the other vital signs for this scenario were within normal limits and less likely to explain the patient's symptoms. So once the nurse starts the fluids, the antibiotics, gives the Tylenol, that person should start having a lower temperature. And then, of course, maybe the confusion will also subside. So we fight the infection and they will improve. Question 20. Scenario: a 60-year-old patient with COPD complains of increasing shortness of breath, confusion, and fatigue. The CNA observes cyanosis or bluish discoloration around the lips and slow labored breathing. Which abnormal vital sign is most likely associated with respiratory failure? Is it a heart rate of 60, a blood pressure of 150/90, a respiratory rate of 16 breaths per minute, or O2 saturation of 82%? The question refers to respiratory failure. Which vital sign shown there would be associated with respiratory failure? And I'm doing my nursing dance because I see some correct answers coming through. You all have it. It is D, the O2 saturation of 82%. It's a critical sign of hypoxemia indicating respiratory failure. The patient's symptoms of cyanosis, confusion, and fatigue all align with insufficient oxygenation, which requires immediate attention. So when there is a change in your patient's level of consciousness, this person who was alert and oriented is now confused. They're seeing bugs. They're trying to get out the bed. Think oxygen level. Okay. Get that vital signs, including the O2 saturation. We have another scenario for you all. And if you stayed for this long, go ahead and hit that like button. Don't forget to share our videos with a family member, a friend, a colleague. And then also give us a like and share our information with others. So question 21, scenario: a 72-year-old patient accidentally aspirates a sip of water during a meal. Shortly afterward, the CNA notes that the patient is coughing persistently, appears short of breath, and has labored breathing. Question: which abnormal vital sign is most likely associated with aspiration? And I'm going to take a sip of water and let you all read that one. So give me the answer in 5, 3, 2, and you have it. It is B. So aspiration often causes airway irritation, leading to an increased respiratory rate, also called tachypnea, as the body attempts to expel the aspirated material and improve oxygenation. Persistent coughing and labored breathing are consistent with this response. The other vital signs remain normal initially. So if they're not able to clear their airway, that's when the other vital signs will start being impacted. Question 22, scenario. A 65-year-old post-op patient who received an opioid for pain management attempts to get out of the bed to use the bathroom. The CNA finds the patient on the floor reporting dizziness before the fall. Question, what is the most likely reason for the fall? Is it A, low oxygen saturation due to medication effects, B, high blood pressure from stress, C, increased pain leading to muscle weakness, or D, orthostatic hypotension caused by the opioid? Ooh, this one's hard. I'll give you 10 seconds. So yes, Hamdi, that's the O2 saturation. So SpO2, in most adult settings, we like it between 94 up to 99%. All right, everybody. I see a mix of answers revealing the correct response in 5, 4, 3, 2, and it wouldn't be a high blood pressure. It would be a low blood pressure. It is D, orthostatic hypotension. So opioids can cause orthostatic hypotension, which is a sudden drop in the blood pressure when the patient changes position. So this patient was fine when they were in bed, but now they stood up to go to the bathroom and their pressure drops, which makes them feel dizzy and puts them at risk of falls. So this side effect is particularly risky for post-op patients, emphasizing the need for assistance with mobility after receiving such medication. So that's when we put the fall alert. We usually put that on all post-op patients because we know they've had that sedation, anesthesia. It may linger in their system a little longer. And then after the anesthesia, well, now they're a little bit alert. They're still having pain. Then your nurse gives them an oral pain medication, such as an opioid. And all that lingers in their body, and it could cause the orthostatic hypotension, which is why we usually do not let them walk by themselves. All right, question number 23. A 54-year-old patient is 1 day post-op after abdominal surgery and has been receiving opioid pain medication. Oh, Lord, these opioids again. The CNA finds the patient unresponsive with shallow breathing and a respiratory rate of 8 breaths per minute. What is the most likely reason for the patient's condition? Is it A, a reaction to anesthesia, B, a pulmonary embolism, C, respiratory depression due to opioid overdose, or D, normal recovery from sedation? Why is your patient only breathing 8 breaths per minute? That's how I want you to think. Revealing the answer in 5, 4, 3, 2, and I am ecstatic. I'm very proud of you. So not only do opioids cause hypotension, they can also cause respiratory depression. So yes, the correct response is C. Opioid medications can cause respiratory depression, meaning that it slows down the way the person breathes. They're not going to breathe normally, particularly when administered post-op. A respiratory rate of 8 breaths per minute is critically low and may necessitate the administration of Narcan. So that's why you got to get that nurse in the room so she can give the reversal agent. All right. And so again, immediate intervention is required, and you never leave a person who's in distress. You stay with them and call for the nurse while you are in the room. Question 22. A patient is experiencing shortness of breath and cyanosis. What is the best immediate action for the CNA? A, provide the patient with a blanket. B, reassess the patient in 30 minutes. C, encourage deep breathing. Or D, inform the nurse immediate. And this is so easy. So I'm just going to go ahead and give you the answer, because anytime there's a change in condition, we are going to do D. We're going to get that nurse in the room, because cyanosis and shortness of breath are signs of respiratory distress, which are medical emergencies. Question 25. Let's see if you remember. What is the normal range for an adult's systolic blood pressure, the top number? Is it 80 to 100, 100 to 120, 120 to 140, or 140 to 160? And this is based off of current standards. So no, I did not put 100 to 140. Revealing the correct response in 6, 5, 4, 3, 2, and yes, you have it because they changed it, you all. So technically, if your systolic blood pressure is higher than 130, you are pre-hypertensive. So I know textbooks will say 100 up to 140 because we usually don't panic if it's 136, but the normal systolic blood pressure range for adults is 100 to 129. Readings outside this range require further assessment because according to current standards, a systolic blood pressure greater than 130 is pre-hypertensive. So, just make sure when you're taking your test, do exactly or choose the answer that most corresponds with your training in your course and what's in your book. All right, so at least you know that pre-hypertension starts at 130, and then whenever the systolic blood pressure is greater than 140, we can classify that person as being hypertensive. All right, so question number 26. A 65-year-old patient becomes lightheaded and pale while being assisted to sit up in bed. The CNA notices that the patient's blood pressure is 80/50. Thank you for taking the blood pressure. And the patient reports feeling faint. Question: why would the Trendelenburg position be appropriate for this patient? A, to assist with easier breathing. B, the Trendelenburg position is never appropriate. C, to promote digestion. Or D, to improve blood flow to the brain. And if you've never said that word before, say it with me: Trendelenburg. Trendelenburg. Revealing the answer in 5, 4, 3, 2, and I'm so proud of you all. Great job, team. Everybody chose D. Yes, to improve blood flow to the brain, we press the button on the bed that's going to invert them. We're taking the blood from the legs, send it up to the brain, send it up towards the heart in order to decrease their symptoms. So the rationale, the Trendelenburg position, that's when the head is lower than the feet, is used to increase the blood flow to the brain, helping to stabilize the blood pressure and prevent fainting. This intervention is effective in cases of hypotension or shock symptoms. But I also have to tell you one more thing, team. You're not a nurse, so you don't put the patient in Trendelenburg without the nurse telling you to do so. Nurses will tell you when to put the patient in Trendelenburg because if this patient just ate, or if they have shortness of breath, or if they have a feeding tube. If you turn them upside down on their head, whenever we do put them in a regular position, we can cause them to aspirate. If we put them upside down and then they are already shortness of breath, we're going to cause their breathing to worsen. So even though you know what position we can most likely put them in, you don't do it without the nurse telling you to do so. I hope that helps you. All right, so that was Trendelenburg. Question number 27. A 40-year-old patient is experiencing nausea, vomiting, and has only produced 100 cc's of urine in the past 8 hours. The CNA notes that the patient appears weak and has dry mucous membranes. Question: what is the most likely cause of this patient's condition? A, dehydration from fluid loss. B, a urinary tract infection. C, overhydration from IV fluids. Or D, a reaction to pain medication. I just love how smart you all are. I'm loving it. I'm loving every moment of it. And so for this question, if you chose A, you have it. You are right. So let's go back and read it. This patient had nausea and vomiting and low urine output. That means they're throwing up. They're getting rid of all the fluids inside of their body. They can't drink anything because it's going to make them throw up more, which is why usually your nurses start IV fluids. And now they have minimum urine output. So this is most likely caused due to dehydration. So nausea and vomiting can lead to significant fluid loss, resulting in dehydration. Dehydration reduces urine output. That's called oliguria. and causes symptoms such as weakness and dry mucous membranes. This situation requires prompt fluid replacement and medical evaluation. So hopefully your nurse is already working on that. But if you see something, you say something, just in case the nurse you're working with that day may have overlooked it. In some of your facilities, these nurses are having 30 and 40 patients. There is no way that she can properly assess all of these patients. So your input is invaluable to help save a patient's life. All right, so question 28, true or false? A syncopal episode refers to a sudden loss of consciousness caused by a temporary drop in blood flow to the brain. True or false? My next videos will be on medications, and I'm going to start shooting those videos around 1 o'clock. So I don't have a video every evening, no. So yes, everybody, if you chose true, you understand what we refer to when we say syncope or a syncopal episode, because it occurs kind of like a fainting spell, occurs due to reduced cerebral perfusion, aka blood flow to the brain, and is often caused by hypotension, dehydration, or a vasovagal response. In other words, they're on the toilet and they were trying to bear down. They were straining when they pooped. Well, that can actually cause their heart rate to drop and they can get dizzy while they're on the toilet. Hi, Taisha. I hope I said that correctly. Yes, I'm excited that you called a live also. I'm trying to do them at different times of the day because I know everyone's schedule is so crazy. Our next question, true or false? A radial pulse that is weak and thready may indicate shock or hypovolemia. Hypovolemia. Person has a weak and thready pulse because you're in there doing vital signs and you're feeling for the pulse for a full minute because that's what we taught you to do in your CNA classes. So it's like, ooh, this is not as strong as it once was. And ooh, it's kind of thready. All right. So revealing the answer in 5, 4, 3, 2, and yes, K Wong. Yes. It is true. So looks like K Wong had true, and let's see who else had true. Imani says true, and Jacoba says true. So a weak thready pulse can signal inadequate blood flow. So if you feel your pulse right now, I am sure that it's bounding, it's strong because you've had adequate fluid, your heart is pumping effectively, but now you feel the pulse on someone who's 80 and dehydrated, and it's going to feel weak. It's not going to be as bounding. So a weak thready pulse can signal inadequate blood volume or circulation, and that's common in shock and severe dehydration. Question 30, we're almost to 40, y'all. Question 30, what does a sudden drop in a patient's blood pressure from 130/80 to 90/60 most likely indicate? Is it A, hypertension, B, hypotension, C, normal fluctuation, or D, tachycardia? All right, so Miss Miller's blood pressure was previously 130/80, and now you check it and it's 90/60. What does that indicate? Revealing the answer in 5, 4, 3. Yes, it is hypotension. So maybe the nurse gave her too much of a good thing. Maybe that was too much morphine. Maybe that was too much Ativan. So the answer is B. A sudden drop in blood pressure is considered hypotension and could indicate shock or other critical conditions. So normally this is going to happen, or more frequently it's going to happen after pain medication administration. Those blood pressures are going to drop. All right, question 31. Where is the carotid pulse located, and why is it often checked during emergencies? So why during an emergency, why don't we just check the radial pulse? So is it A, on the chest to evaluate heart rhythm, B, on the wrist to measure blood pressure indirectly, C, on the side of the neck to assess blood flow to the brain, or D, behind the knee to check circulation to the lower extremities? Because it's not enough just to know why or what you were doing. It's like, yeah, I know how to check the pulse in an emergency. Why are you checking that pulse? Why don't you just check the pulse you normally check? So revealing the answer in 3, 2, and hold up. Yay! Everybody got it right. It is D, on the side of the neck, to assess the flow of the blood to the brain. Let's see, a lot of you all chose C. So I have, you all are right. It is C. It's not D. I just have my numbers incorrect there. So it is C. The carotid pulse is located on either side of the neck and provides a direct indication of the blood flow to the brain. It is often checked in emergencies. So if you go in a room and a person's talking to you, do not go for their carotid pulse. You would take their radial pulse. But when you do that tap and that shout, you check for responsiveness, and this person doesn't say anything, directly to the carotid pulse for 10 seconds. That's during an emergency. That way you can tell if you feel a pulse, it's like, okay, you're still calling a nurse in the room. But if you don't feel a pulse, not only are you calling a nurse in the room, you're starting CPR immediately. So let me go back and read that. The carotid pulse is located on either side of the neck and provides a direct indication of the blood flow to the brain. It is often checked in emergencies, example, cardiac arrest, because it is a central pulse, making it more reliable in situations of low blood pressure or shock. And you never want to palpate both of the carotid arteries at the same time, because you would be decreasing the flow of the blood to the brain. So you only feel on one side at a time. Question number 32. When taking a patient's vital signs, the CNA finds the following. The blood pressure is 180/100. The pulse is 80. The respirations are 20. Which finding should be reported first? Is it the blood pressure, the pulse, the respirations, or all of them? Because remember, your nurse got 30 patients. And when you come into old nurse, I won't say nurse ratchet, when you're going to the most friendliest nurse in the hospital, and it's like, hey, I need you to look at the vital signs, patient in room 342. And she's like, all right, what vital sign? What are you talking about, Rebecca? You need to be very specific in your conversation. So what vital sign are you going to mention first? Revealing the answer in 5, 4, 3, 2, and for this one, the answer is not D. You have to prioritize. The one that is abnormal is A. So the blood pressure is critically high and must be reported immediately, as it could indicate a hypertensive crisis. So the others are nice to know, but the report would be something similar to this. It's hello, the nicest nurse on the unit. Let's say her name is Nurse Eunice. I was taking care of Miss Jenkins in room 342, and her blood pressure was 180/110. All of her other vital signs are normal. I just want to make sure that you can go in there and check her right now. She appears to be okay, but I need you to come in with me. Period. Done. Make sure you document the vital signs and that you notify the nurse. So we sometimes don't mention every vital sign if the others are normal. We focus on the abnormal vital sign. That's the most critical. All right. So question number 33. Why is the radial pulse typically assessed during routine patient care? A, it is the most central and easiest to locate. B, it reflects the strength and rate of peripheral circulation. C, it provides the most accurate measure of heart rhythm. Or D, it can be used to detect oxygen saturation levels. Why do we take the radial pulse? Revealing the answer in 5, 4, 3, 2, and looks like I have 2 correct answers so far. The first correct answer came from her reg. The second one comes from Jacobus. And you all, it is B. So how is the blood flowing throughout the body? That would be peripheral circulation. So the radial pulse located on the wrist on the thumb side is often used to evaluate peripheral circulation to determine the heart rate. Its accessibility makes it convenient for routine monitoring. Central pulses like the carotid pulse are used in critical situations, what I just mentioned, not routine care. So that is the difference. So when you're taking a radial pulse, that means that person must be moving, they're talking to you, they have good circulation throughout their extremities. Question number 34. Let's see if there are any new comments. All right, question number 34. Where is the apical pulse located, and why might it be checked instead of the radial pulse? A, at the wrist for assessing irregular heartbeats. B, behind the knee to check blood pressure in the lower body. C, over the heart at the fifth intercostal space to evaluate cardiac function, or D, on the neck to monitor blood flow to the brain. And if you don't know what the apical pulse is, it is okay. That's usually a term that you will be taught in nursing school. So revealing the answer in 6, 5, 4, 3, 2, and so many people have the right answer. Let's see who has it first. Looks like Chrissy has it first, and then Mirtha and Renita and Gladys. So it is C, everybody. It's over the heart at the fifth intercostal space. The apical pulse is auscultated. So usually we listen. So we put the stethoscope in and listen at the apical, at the apex of the heart. And so it is mid-clavicular. It is checked when a more accurate measurement of heart function is required, especially if there are irregular heart rhythms or discrepancies between apical and radial pulses. So usually only nurses check apical pulses, but I need to make you aware because you have to know this terminology. Question 35. Which of the following is the most critical sign of respiratory distress? And I'm going to take a sip and wait for your answer. So is it A, B, C, or D? And I'm so glad you're here with us. Happy New Year to everybody if you weren't here at the beginning. All right, so which of the following is the most critical sign of respiratory distress? I couldn't trick any of you. I couldn't trick you. I am so proud of you. So it's not B. B is too close to normal. So sometimes your patients have sleep apnea. Then they don't breathe for a few seconds. And so that person, they're fine. This is what they normally do. Their respiratory rate is 11. Try to wake them up, try to stimulate them, and bam, the respiratory rate is back to 12, which is normal. So for this one, it is not B. For this one, it is not C, a O2 set of 92%. Remember those patients with COPD? They like to hang around 93, 94, 95%. So an O2 set of 92% is not the most critical of this one sign of respiratory distress. A sign of respiratory distress is going to be they turned blue, y'all. It's going to be D, cyanosis. And so Black people typically don't turn blue. So you all, the only way I'm going to turn blue is if you give me some blueberries. So I don't turn blue. I turn like this grayish color, this dusky color. You can tell that my skin is paler in an area, but usually brown skinned people do not turn blue. So cyanosis on us appears different than it would be on fairer skinned people. But the answer is D. So cyanosis, or palish skin on dark or toned people, indicates inadequate oxygenation and requires immediate intervention. Oh, thank you so much. All right, so let's go to question number 36. What is the normal oxygen saturation level in a healthy adult? I've given you this answer 3 times now. So is it 85 to 90, 90 to 92, 92 to 94, or 95 to 100%? Revealing the answer in 5, 4, 3, 2, and that's right, Sherman and Imani, you all have it, and Merlin, it is D. So technically 99% we're okay with. We don't like people being, especially if we're giving them supplemental oxygen all the way up to 100% consistently, because that can cause other issues. So, if you see us not freaking out because your patient's O2 sat is 98% on room air, that's because that's still considered normal. We don't have to put oxygen on them. So everybody, great job. Question number 37. Why are we talking about TED holes? And this is a video on vital signs, because you need to know about TED holes. Nurse Eunice said so. So in which situations are TED holes most likely to help manage blood pressure? Is it A, a patient with high blood pressure due to a salt-rich diet? B, a patient experiencing orthostatic hypotension upon standing? C, a patient with high intracranial pressure? Or D, a patient with low blood pressure caused by dehydration? When you're putting those tight compression holes, aka those TED holes on a patient, why? Why are we reminding you constantly to put those holes on the patients? And so revealing the answer in 5, 4, 3, 2, and For this one, we usually don't put TED hose on for dehydration. If someone is dehydrated, the nurse needs to start an IV to rehydrate them. And the CNA, according to their dietary restrictions, should be encouraging them to drink more water. So we don't put TED hose on for dehydration. We put TED hose on because this person, when they stand up, their blood pressure drops. So the answer is B. Great job, team. So TED hose can help manage orthostatic hypotension by improving venous return and preventing blood from pooling in the lower extremity when the patient moves to an upright position. They are not effective for the other causes of blood pressure changes, such as dehydration or diet-related hypertension. So, yep. You see TED hose in that patient's room, I want you to think, wow, if I don't put these on, her blood pressure is going to drop and she might fall. That's the correlation I want you to have. So put those TED hose on while they're still in the bed before you stand them up. Question number 38. Merlin, I don't understand that emoji. Do explain. All right, so question 38. A 5-year-old patient presents with a heart rate of 140 beats per minute. Yes, as a CNA, you can work anywhere where a nurse works. So you could be working with kids also. So this 5-year-old has a heart rate of 140. The respiratory rate is 30 breaths per minute, and the temperature is 102 degrees Fahrenheit. The child appears irritable and has flushed skin. What is the most likely reason for the elevated heart rate? Is it A, anxiety due to being in a hospital setting, B, pain from an unknown source, C, dehydration from fever, or D, normal variation for a child this age? So after you pass your CNA examination, if your class did not focus on a whole bunch of pediatric illnesses or pediatric vital signs, which most won't, because the CNA exams are usually geared toward an adult population, I need you to take it upon yourself. You can go to the American Association of Pediatrics. I need you to learn about taking care of pediatric patients, especially if you want to work in a pediatric hospital. So we're revealing the answer in 5, 4, 3, 2, and you all are right. It is dehydration. It is C. So fever increases the metabolic demand and can lead to dehydration, causes compensatory tachycardia. While anxiety and pain may also contribute to an elevated heart rate, the presence of fever, that heart beating so fast, this person sweating, the flushed skin makes dehydration a most likely cause. And of course, your nurse is going to be right there because immediate attention to fluid status is critical. Question number 39. A 45-year-old recovering from a cardiac procedure suddenly becomes unresponsive and is not breathing. The CNA checks for a carotid pulse but cannot feel one. Question: what is the first step the CNA should take? A, begin rescue breathing immediately. B, call for help and activate the emergency response system. C, check for a radial pulse and recheck for signs of breathing. Or D, start chest compressions at a rate of 50 per minute. Oh, I see some varying answers, but the most answers I have are all correct. You all know we got to get the nurse in the room. It is B. You're going to call for help. You're going to press that code button. We need a whole code team. In the event of cardiac arrest, the first step is to activate. You got to get help. Activate emergency response. So it doesn't say press the code button, because if you're working in a nursing home or maybe assisted living facility, or if you're in a home care environment, there may not be code buttons. You're going to have to get on the phone, especially if you're in home care, and call 911. So you're going to activate emergency response because help needs to come with the AED. And then after that, your priority is, if they don't have a pulse, is to begin CPR at a rate of 100 up to 120 compressions per minute. Remember, if you don't have any protection, you are not going to be given rescue breaths, because you could either give the patient something or you could contract something from the patient. So rescue breaths are usually not going to be performed until your other team members come. If you're in the hospital, they're going to come with a crash cart that has the back mask device. If you're waiting for the ambulance to come, of course, when they come, they'll be able to take over the airway. Your job is just to keep doing those compressions. Don't stop, don't stop, don't stop until someone else can come and help you take over those compressions, or until a team with more experience comes to relieve you. All right, so question number 40. I can't believe we're at the end. Oh, I'm going to miss you all, but I'll be back. I'll be back at like 1 o'clock for my next video. All right, so a 60-year-old patient recovering from knee surgery suddenly complains of sharp chest pain and difficulty breathing. The CNA notices the following vital signs. The respiratory rate is 30. Uh-oh. The heart rate is 120. The blood pressure is 90/60 and the O2 sat is 85%. Lord, we got some work to do. Here's your question, team. What should the CNA suspect and what is the appropriate actions? Let me just go back. What was her sharp chest pain, difficulty breathing? These are her vital signs, and she just had surgery. A, the patient is having a panic attack, reassure them and encourage slow breathing. B, the patient is dehydrated, offer oral fluids and reassess vital signs. C, the patient is experiencing normal post-op pain, document the findings and recheck in 15 minutes. Or D, the patient may have a pulmonary embolism, notify the nurse immediately. Now that was a lot to say. Revealing the answer in 5, 4, 3, 2, and yes, everybody, it is. Now that says B, but we know Nurse Eunice did this in the middle of the night. So the answer is D, not B. D, the patient may have a pulmonary embolism. Notify the nurse immediately. So anytime we have surgery on long bones, there's a possibility of a clot being formed. And that clot would be a DVT if it was just stationary. But once it starts traveling, it can travel. Now it's an embolus. It can travel to the lungs and become a pulmonary embolism. And so the combination of chest pain, tachycardia, hypotension, and low oxygen levels would be consistent with a person who has a pulmonary embolism, or what we would call a PE. That's a life-threatening condition. So your job is to recognize it and get that nurse in the room so that we can provide that patient with the care that is needed. And it's going to be today at 1:30, but it's going to be on medication. So we had a lot of requests for videos on medications. And then I see that Nathan has a question about making videos on Alzheimer's, stroke, dementia, and diabetes. I have a full playlist, Nathan, so we've already done all of those except for Parkinson's disease. You just have to go to our CNA playlist. And so everybody, guess what? We did it. Please give yourself a round of applause. I am so proud of you. I love being your online tutor, your nursing professor. This is Nurse Eunice, and I'll stay around for a few more moments to see if you all have any questions before I begin preparation for our next video. Hey family, guess what? We are this close to having 1 million, 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. Hey everybody, it is Nurse Eunice with Florida Training Academy, and I have missed you all so much. I see a few of you all in the chat, so hello, welcome, and I look forward to helping you pass your CNA examination. So as we do in each of the videos, I will give you about 10 seconds to receive your notifications, and we will get started shortly. All right, let's get ready to have fun, everybody. Tonight's video is about long-term care, so we'll talk to you about the differences between long-term and acute care and how this test is going to help you pass your CNA examination. So, hi again. All right, and so this is very near and dear to me. You all, next week is National CNA Week. That's right, you get your own week. So if you are somebody who knows a CNA and you want to nominate them, you will send an email with their name, the reason why you think they make a great CNA, and a photo, which is optional, to admin@fltraining.com. And I'll make sure I put that in the chat. Again, that is admin@fltraining.com. And so what will they receive? First of all, they're going to receive a shout out on all of our social media channels, including our YouTube channel, which has almost 1 million subscribers. They're going to receive a digital certificate of excellence. They're going to receive a badge from Nurse Eunice, from me, that they can put on their resume, etc. So we want to help you honor those who help you so much. And so if you know a CNA who is deserving, who's worthy, who goes above and beyond, please send that nomination in to us. All right, so hi, Monka. Hi, Benita. If you haven't already done so, you can download our free study guides. You can either go to nurseeunice.com, which is shown on the screen, or you can go to fltraining.com/links, which is in the description area. All right, and so let's help you with your long-term care. In case you have questions, whenever you take your CNA test, a lot of those questions are not based on hospital level CNA work. It's based on long-term care, as if you have a resident. And so this test is to help you prepare for those types of questions. And so let's give you a welcome. Welcome, future CNAs and caregivers. In today's video, we'll break down the key differences between long-term care, home health care, and acute care settings like hospitals. I see so many familiar names. I love it. And so each setting offers unique experiences and responsibilities for CNAs. Home health care means one-on-one care in a patient's home, often involving flexibility and independence. 4-hour shifts, or you can just do a 1-hour stay with the patient, and you'll have maybe 8 patients in a day to total an 8-hour shift. Versus hospital or acute care, that's fast paced. In a hospital, they don't necessarily call you a CNA. Your title will be patient care tech, patient care associate, but the care is focused on short term. Person comes in, they have a medical concern. We're going to try to get them back to their normal state of health as quickly as possible, and then get them home. And so when you think of acute care, think of short-term critical care with a variety of patients, anybody from a laboring mother to a pediatric patient who may have had a sports injury, all the way to the end of life, someone who's on hospice. Now, long-term care would be like nursing homes or assisted living facilities. They center on building relationships and providing consistently daily support to your residents. And so with long-term care, sometimes they will offer 8-hour shifts. So if you want to only work a few hours a day, you can do home care. If you're okay with working 8-hour shifts, think long-term care like nursing homes and assisted living facilities. But when you're ready for the fast-paced lifestyle, that is when you would take your CNA license, go apply at a hospital for a patient care tech position. So each of those levels has a different scope of practice. And so, but your overall goal as a CNA is to keep that patient safe, and of course, to notify that nurse if something goes wrong. All right, so let's see what you all have in the chat. I'm so proud of you. Congratulations. I think it's Maker Link. Congratulations. Very proud of you. All right, so long-term care, we're going to continue on learning about the unique needs of long-term care residents is essential for passing your CNA examination and providing compassionate and consistent care. These residents rely on CNAs for daily support, dignity, and safety. Understanding their needs will make you a stronger caregiver and a better test taker. If you haven't already done so, go ahead and get those pens, some scratch paper, be in a quiet area, and let's get ready to take our practice test. All right, team. All right, question number 1. A resident who is unconscious is at risk for, is it bed sores, diarrhea, anemia, or falls? I'll give you about 5 seconds to put the correct answer in the chat. All right, we're going to be revealing that answer in 5, 4, 3, 2, and Anastasia and Nell and Sandra, Vivian, Messi, Miss Bonita, you all have it correct. Everybody chose A. That is right. Immobile and unconscious residents are at a higher risk for skin breakdown due to pressure, which could lead to pressure sores. Question 2.
Which of the following is a sign of hypoglycemia? Would it be A, fruity breath odor, B, slow heart rate, C, cold, clammy skin, or D, increased urination? And I'll give you a few moments to answer this question also. And thank you all for joining me on a Wednesday Night Live. I appreciate you all. I love studying with you. All right, here we go, team. If you chose, this one's a little bit tricky. It is going to be C. So I see A's and I see D's. So whenever you think of the fruity breath odor, that is for somebody who has uncontrolled diabetes. That means their blood sugar levels are high. And whenever someone has polyuria or increased urination, that's usually a sign of high blood sugar, hyperglycemia. So if you chose C, you understand that cold, clammy skin is what we call diaphoresis. And so that would be usually caused due to low blood sugars or hypoglycemia. All right, so question number 3. Which resident should the CNA assist first during your morning rounds? Would it be a resident requesting a shower, a resident who needs help finding their dentures, a resident asking for water, or a resident who needs help to the bathroom? Who would be your priority? And you can't say all of them because you're only one person. You can't do everything at one time. All right, revealing the correct response in 5, 4, 3, 2, and couldn't trick a one of you. You knew the answer was D, because a resident who needs to use the restroom is at a higher risk of falls and also of incontinence, meaning that they can urinate or defecate on themselves. And so that's the patient that you want to make a priority. Question 4. What is the correct method to measure urinary output in a graduated container? Would it be A, estimate the amount visually, B, hold the container up so it can be read at eye level, C, tilt the container to see the numbers, or D, read at eye level on a flat surface? So you just empty the drainage bag. You need to empty the contents from that drainage bag. How do you read what's inside of it? All right, we see some correct responses coming through. So we're revealing the correct response in 5, 4, 3, 2, and for question number 4, if you chose D, you have it, especially when you're taking your CNA test. Not only do you have to read your graduated container at eye level, you have to put a napkin beneath the container. So you're going to take the container into the bathroom, put your napkin down first, your container on top of it, you bend down, you make eye contact, look at those numbers. When the fluid is no longer moving, that would be the correct reading. Also give your nurse time to see, because usually, especially for the state of Florida, your reading can only be 50 cc's away from your nurse. So make sure your nurse sees your reading before you pour the simulated urine into the toilet. So great job, team. Question number 5. A resident begins to fall while you're walking with them. You should A, try to carry them to safety, B, hold them up firmly, C, ease them to the floor safely, or D, let go to avoid hurting yourself. Your patient begins to fall. What's the best response? That is right, Toyin and Vanette and Sophie. You all, we're doing an assist. That is not a fall. You have that gait belt. You're going to slide them to the floor while you're screaming for help. Do not try to hold them upright. And when you have them on the floor, go ahead and lay them on the floor. Don't want to have them still upright, sitting down on the floor, because if they have low blood pressure, they're still dizzy. There's not enough blood flow going to their brain. So go ahead and lay them down. And if you can, raise your feet, maybe put their feet up on the chair. And those nurses, everybody's going to be coming, running to you. We will help get that patient back into the bed safely. So your first step is to get them to the floor. Question 6. What is an example of a CNA violating a resident's privacy? Would it be A, sharing a resident's diagnosis with a roommate, B, closing the door before assisting with toileting, C, pulling a curtain before dressing a resident, or D, knocking before entering the resident's room? Oh, this one is so easy. I'm only giving you 3 seconds on this one. This was super easy. That's right, Tanaka and Manka and Mickerlin. We can't fool you all. It was C. I hope you're as proud of yourself as I am proud of you. Question 7. When communicating with a resident with hearing loss, you should A, speak slowly, B, shout loudly, C, speak clearly and face them, or D, use exaggerated lip movements. I'm happy y'all couldn't see me do that. So, team, what do you think the correct response is? That's right, Miss Sharon and Adeline and Josephine. It is C. So it's really hard, especially when times when we have on full PPE and we have to wear our mask. I want you to, be mindful though. If somebody has an impairment, it's going to be hard for them to read your lips if they have a hearing impairment. Sometimes the way they supplement or they overcome their hearing impairment is by reading lips. So if you do have on a mask, you may have to speak a little bit louder, but at no point should you be screaming. So facing a resident and speaking clearly helps them read lips and to understand. Question 8. A CNA should report which of the following to the nurse immediately: mild swelling in the feet, or a resident who refuses breakfast. C would be a heart rate of 98. Or D would be a resident with a temperature of 101. So you're probably going to tell the nurse about all of these, but which would you tell the nurse about immediately? All right, I see a lot of correct responses coming through. All right, revealing the answer, and we're torn between C's and D's. And now I see an A coming through. All right, so let's talk about A. Mild swelling in the feet is not something you have to tell the nurse about immediately. What you can do as a CNA is you can elevate the feet while you're in the room, and when you see the nurse in the hall, you can let her know. A resident who refuses breakfast, the same exact thing. You can let the nurse know when you see her in the hall. A heart rate of 98 is not necessarily what you're going to let the nurse know about immediately, because you have to know your normal ranges. And so for an adult, a normal heart rate is 60 up to 100 beats per minute. So if the resident's heart rate is 98, is that the resident's normal range, or has it increased significantly? If it has not increased significantly, that is not anything you're going to tell the nurse about immediately. However, that temperature of 101 degrees Fahrenheit indicates that your patient has a fever. So make sure, because we usually have you recheck vital signs twice if they're abnormal. Take off some of those extra blankets. Maybe the room is really hot because, our elderly patients, they're cold natured, and so they like to keep the room hot. See how you can adjust the temperature of the room. Maybe pull back a blanket, give it 15 minutes, recheck the temperature. But if that temperature is still elevated, signs of an infection, go let your nurse be made aware. And after you notify your nurse, that is when you would document. Hey, Abiola. All right, so question number 9. A resident often carries a doll and treats it like her baby. One day she is wondering and crying that she can't find her doll, her baby. What should the nurse aide do? A, ask the resident where she last had the doll. B, comfort the resident and help her look for her baby. C, ask the activity department if they have any other dolls. Or D, let the other staff know that she is confused and should be watched closely. I saw some more good news. Congratulations, Ellen. Hey, ma'am. Thank you so much for your effort. You helped me pass my test after failing 2 times. May God bless you. I am so proud of you. Keep up the good work. And whenever you are in a position to teach, keep teaching, because eventually something's going to sink in, and maybe you could be the person who helps somebody else pass their exam. And so we're always going to pay it forward. So thank you for letting me be made aware, and I appreciate you. All right, so question number 9, everybody. The correct answer is B. Supporting the resident's emotional needs and helping her look for her doll validates her feelings and her feelings and maintains trust. So let's go back, because I see some people who chose C. The reason why it's not C is because maybe her doll was brown skin, and the activity departments may not have any other brown skin dolls, or maybe her doll had on a particular dress. So if you just go to the activities department and try to trick her to get another doll, she's going to be like, hey, you took my baby. So it's just best to help her look for the actual baby. I know that she has some type of confusion, maybe dementia, but it's best to help her look for her actual doll, because I'm sure there's something about it that she will remember and she'll recall. All right, question number 10. A nurse is asked to change a urinary drainage bag, but has never done it before. What should the nurse aide do? A, change the indwelling catheter at the same time. B, ask another nurse aide to change the bag. C, change the bag and ask for help if needed. D, ask the nurse to watch while changing the bag since it is the first time. And I expect for a lot of you to get this answer correct. And you did not disappoint, Edward. I see you, and Anastasia, and Allie, and Veronica, and Josephine. Yes, it is D. Look, you all. Whenever you get hired on a job, they're usually going to give you a checklist, and that checklist may have 3 pages of skills that you should be watched while performing. And if you don't know how to perform something, you're going to tell them, hey, I don't know how to do this, so that the nurse can, number one, teach you, show you how to do it. So we'll usually show you once, we'll watch you as you do it, and then hopefully by that 3rd time you're competent and you can be signed off on it. So safety and supervision are key. It's appropriate to seek guidance when performing a task for the first time. That prevents injury to the patient. Okay, remember, patient safety. Go ahead and ask for help. Question 11. Which of the following is considered a restraint? Would it be A, side rails left down, B, a seatbelt used in a wheelchair for safety, C, tucking in sheets so tightly a resident cannot move, or D, having the call light within reach? Which would be considered a restraint? Yes, 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 yes. So when I started nursing way back in the day, we would like literally take an additional sheet and wrap it around our patient's legs and tuck it tightly under the bed. Yeah, that was a restraint, and that was illegal, but that was back in the day. That was 20 some odd years ago. So now we know better. We do better, and we know better. So you all cannot tuck those sheets so tightly that the resident cannot move. That would be a form of restraint. So the correct response is C, any method that restricts voluntary movement, such as overly tight sheets, can be considered a restraint. And so what do we do now? We would actually get an order for a sitter, or we would have a bed alarm so that if the patient tries to get out of bed, they'll be alerted. The patient should be able to move. We just don't want them to get out of bed without assistance. Question 12. Which is a job task that a CNA is allowed to perform? Is it A, participate in care planning conferences, B, take telephone orders from doctors or physicians, C, administer medications, or D, change sterile dressings? And we have another testimony. Hey, Louise. So today is 1 week. I took my CNA exam, and guess what? I passed. Thank you so much. I am so proud of you. Congratulations. And thank you for coming back and letting us be and telling us so we can celebrate you. So you all, we've had about 5 people who've come on and say they passed their CNA exam. So if you're worried about passing your exam, don't be worried. Just practice. Find a study buddy. Read our questions. We have so many questions. So there's no reason for you to fail. My job is to help you get into healthcare, to be confident, to be competent, because I need you all. We need you all. Our patients need you. So we're going to make your lives easier and help you study for your test. Everybody, question 12 is tricky. Let's see. I have A's, I have B's, and it looks like I have a D. So the correct response is hey. So you all, that's nothing more than a meeting. And the CNA spends the most time with the patient. So if a patient has a resident care planning conference, aka a meeting, you're going to be there. So CNAs may contribute observations such as she's not eating that well, she refuses to use her dentures during a care planning conference, but cannot perform clinical tasks reserved for licensed staff. So what you cannot do is with a regular CNA license. Now in some states, Once you have a year of experience and you take an additional class, you can administer medications, but that's not for your test. For your CNA test, you cannot take a telephone order from a doctor. So if they are, I don't care how fast they're calling out these orders, you have to put them on hold and let them know that you're getting the nurse to the phone. Because even if you tell me the right order, I cannot take an order from a CNA. I have to get it from a physician. So you put the doctor on hold. So you can't do B. As a CNA without that advanced training, you cannot give medications, and then you do not do sterile gloving. You put on clean gloves. When you think of sterile gloves, think of something invasive. And as a CNA, you cannot go inside of the body. So who would be able to put on sterile gloves? A patient care tech working in a hospital, because they may have to help with urinary catheterization, which requires a sterile technique because they are inserting a catheter inside of the body, inside of urethra. So I hope that helps you understand question 12. Question 13. Thank you so much, Roxana. All right, question 13. What is true about range of motion ROM exercises? A, are they only done once a day? B, are often performed during ADLs like dressing? And while I'm reading the other questions, if you know what ADL stands for, please put it in the chat. Would it be C, require 10 repetitions per move? Or D, prevent strokes and paralysis? All right, so which is true about ROM exercises? That's right. So we have the correct responses, and then Veronica put in the chat that ADL stands for activity of daily living. And for everybody who put B, you are correct. And so ROM exercises can be incorporated into daily activities to maintain joint flexibility and mobility. So when you go into a room, you're not doing a nursing assessment, but as a CNA, you still get to look, you get to assess. So if you see me scratching my face, maybe touching my head, that more than likely means I can at least comb one side of my head or brush it. And if during the bath you needed assistance, you would give me the washcloth so that I can wash my face. My rule of thumb is, unless they're confused, they have dementia, if they can touch it, they can wash it. If they can reach it, they can wash it. And so I need you to be thinking about that. Even if a patient has had a stroke, the side that they can move, you want to encourage them to move it, especially during bathing and just basic skills. So if they need help feeding themselves, maybe they can actually feed themselves the toast, but you manage the food that's on the actual spoon. But please ask your patients to help in their care so that they won't become so dependent on us. Question 14. What is a sign of dehydration in long-term care residents? Is it clear speech, good skin turgor, moist lips, or strong urine odor? A sign of dehydration. A sign that you may want to consider asking that patient to drink some water. And that's my hint. So everybody revealing the correct response in 3, 2, and yes, it would be D, strong urine odor. So dark, strong smelling urine, dry mouth, and low fluid intake are all signs of dehydration. Encourage more fluids. And if they don't want fluids, don't forget some of your facilities have popsicles. So give them what they want so that they can get some fluids if they don't want to drink the water. Question 15. When making an occupied bed, you should A, roll the resident to one side, B, make the bed while the resident is asleep, C, place dirty linens on the floor, or D, ask the resident to get out of the bed. I want you to think about D. If the resident could get out of the bed, you would not be making an occupied bed. You would have them in the freaking chair. So we know it's not D. So what is the next best response? Yes, everybody, it is A. So whenever you are assisting someone, whenever you're making a bed with them in it, you want to turn the resident safely to one side while changing the linens on the opposite side. And we have full videos on our YouTube channel. We have videos whenever you go to the playlist. We have a full clinical skills library. So it's no reason for you to fail your written or your clinical tests because Florida Training Academy and Nurse Eunice has you covered. All right, question 16. A confused patient tries to grab a hairbrush while being dressed. What should you do? Should you put the hairbrush away? Should you let the resident hold the hairbrush? Should you dress the resident faster, or should you restrain the resident's hands? They're trying to grab the hairbrush. You're trying to dress them, and they're over here in la la land trying to grab a hairbrush. What do? We are torn between A's and B's. I love it. Now, I want you to just for a moment disregard the fact that this is a resident in a facility. What if it was a toddler and the toddler just kept reaching for something and it was distracting them? Would you take it out of their hand, or would you let them hold it and then you dress the other hand while they're distracted? So the best response is going to be B, letting the resident hold the brush. They weren't hitting you with the brush. They were just trying to hold the brush. Let the resident hold the brush gives comfort and reduces resistance during care. I do want to go back because maybe some of you all wanted to remove the hairbrush because you thought the patient was going to hit you with it because the resident was confused. Remember to, whenever you're reading your questions for your test, to don't add anything. Just because the resident is confused, it does not mean they're combative. You have a lot of patients who are pleasantly confused. They're like, la, 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 la. Just leave me alone. Let me hold my hairbrush. Let me hold my doll. I'm going to be okay. That doesn't mean they're going to hit you. So confused versus combative, two different things. See if there are any new comments. All right, so question 17. A resident who is alert and oriented is found on the floor. The CNA should A, help them up and say nothing. B, report the incident and complete a fall report. C, stay with them until the nurse arrives. Or D, move them to their bed without asking questions. All right, looks like we're torn between C's and B's. It's like half and half. And looks like the C's have it. So what I do want to say is, Danica, you were fast. Like no sooner as I got the last option out, you were putting C in there. So great job, girl. All right, so everybody, question 17. What you want to do first is stay with them until the nurse arrives. Okay, that's the priority. What are you going to do? Go document and leave your resident on the floor? So the rationale. So the answer is C. Even if a patient appears alert and uninjured, a fall must be treated seriously. The CNA should stay with the resident, offer reassurance, and notify the nurse immediately so a proper assessment can be done before the resident is moved. CNAs are not allowed to assess injuries as far as, oh yeah, are you measuring wounds? Are you doing any of that? No, you can pretty much do a pain scale or a pain assessment so you can let the nurse know. So since you can't do those nursing assessments, you should not be moving that resident before the nurse comes in and checks them. And then once the situation is handled safely, that is when a fall report can be completed. Remember, think safety first, then report, then document, because in your documentation, you have to document the nurse that you reported everything to. So safety, report it to the nurse, and then document after the fact. Hey, question 18, team. When providing foot care to a resident, it's important to A, remove calluses and corns, B, check the feet for skin breakdown, C, keep the water cool to prevent burns, and then D, apply lotion between the toes. And Anastasia, how are you going to tell the nurse? That is a good question. So let's talk about that. If you're in the hospital, there's usually a panic button that you can press above the patient's bed, and that's going to alert the whole floor that it's an emergency. You can also scream out help. If you're in the nursing home, they also have some type of devices where you can call for the nurse. If you're in home care, sometimes you're going to call 911 first, but your home care agency will teach you the steps, their policies. You'll call 911 first to get them there because they may get there before the nurse does. We're not going to leave a patient on the floor for an hour until the home care nurse can arrive. And so 911 will come and assess the patient, and then second, you will be calling the nurse. So I hope that makes sense. Hospital, nursing home, press the button. Home health, call 911 if your facility tells you to do that first, and then call your nurse second. Hey family, guess what? We are this close to having 1 million. Hold up, 1 million subscribers, and we
we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family.
All right, so for question 18, everybody, it is B. So CNA should never remove corns or calluses. You're not a podiatrist or a foot doctor. Checking for cuts or skin issues is crucial, especially in diabetic residents. Lotion should not be applied between the toes due to infection risk. So great job if you knew that 18 was B. All right, question 19. If a resident has a do not resuscitate or a DNR order and stops breathing, what do you do as a CNA? Is it A, begin CPR, B, call 911, C, try to wake the resident up, or D, notify the nurse immediately? And that's very scary if you've not, encountered that happening before. So your patient has a DNR order, they stop breathing. What do you do as a CNA? And everybody got it right. That is correct. You're going to do D. You got to call that nurse in there. So DNR orders must be honored. Usually if you're in home care, they're on a refrigerator. If you're in a facility, they're in the chart, and your patient may have a bracelet that says DNR. Some facilities don't do that. But whenever you get your report each day, you should know your patient's code status. That's one of those questions you're going to be asking. And if it's a DNR, you know that if they stop breathing or if their heart stops, you are notifying the nurse. You're not performing CPR or doing any life-sustaining acts. All right, question 20. Frequent coughing while eating may be a sign the resident is A, having difficulty swallowing, B, getting full, C, needs to drink more fluids, or D, is choking. The person begins to cough while they are eating. I'm going to give you about 8 more seconds for this one. All right, revealing the correct response in 5, 4, 3, 2, and if they are coughing while eating, that is a sign that they are aspirating. It doesn't mean that they're choking. Remember, when someone's choking, there is no sound. There is no coughing. That is when you would do the abdominal thrust, previously referred to as the Heimlich maneuver. But when someone is coughing, you encourage them to cough. A way to prevent aspirations is to make sure your patients are sitting up in the bed. Make sure they're sitting up before you feed them. If they can't sit up because they don't have core strength, put some pillows behind them because that will help them be in the proper position to help decrease the chances of aspiration. All right, question 21. When a person is admitted to a nursing home, the CNA should expect the resident to A, have problems with incontinence, B, require a lot of help with personal care, C, experience a sense of loss related to the life change, or D, adjust quickly if admitted from a hospital. What do you think, team? All right, we have B's and we have C's. But we have way more C's than B's, so I am proud of all of you. And the correct response for this one is going to be C. Even though they may appear independent, residents often feel grief, anxiety, or loss when moving into a long-term care facility. They may have to stop driving. Now they have to wake up when when you're out there making noise in the morning, you're laughing and giggling, you're going to wake them up. They can't watch what they want to watch on TV because they don't have all the stations they have at home. So there is a real loss, a sense of grief. And so they may not need help with personal care. But you can pretty much guarantee if they're now institutionalized, if they're in your facility, that they are going to be having some issues adjusting. And that's where you come in at. You befriend them. You try to make them feel warm and welcome. And you try to make that facility feel as close to home as possible, because this may be their home until they pass on, until they die. Question 22. How often should incontinent residents be checked for soiling? Would it be every 8 hours or as needed, every 2 hours or as needed, every 30 minutes or as needed, or every shift? All right, so your patient, they don't want to wear a diaper. We don't call them diapers. We call them briefs, but I'm old and I still call them diapers. My apologies. So they don't want to wear their incontinent brief. And so they may sometimes leak urine. You have 20 patients. How often are you checking your resident for incontinence? And if you chose B, you have it. The other response, every 8 hours is far too long, and every 30 minutes is far too often. You have a lot of patients, so we do not expect you to keep checking on an incontinent patient every 30 minutes. But what you would do is every time you go into that room, maybe offer them to use the bedpan or to see if they want to get up and actually get onto the toilet or the bedside commode. Sitting upright is going to help more of the urine be expelled, and that would help decrease their chances of being incontinent. Question 23. A resident whose spouse recently died stays in their room and eats very little. The CNA's best response is to A, remind the resident to be thankful for the years they shared. B, tell the resident to get out of the room at least once a day. C, understand the resident is grieving and give them chances to talk. Or D, avoid mentioning the spouse during care. That is right. Everyone has it correct. It is C. So grief is natural. So CNA should offer emotional support and encourage the resident to talk about their feelings when they're ready. And don't forget, when we're talking about communication with your residents, it's usually more about you listening and less about you talking. So you want to give them the opportunity to talk and let them know that you're there to listen. All right, question 24. Oh, a resident is sexually inappropriate. What should the CNA do? A, set firm, respectful boundaries and report it. B, walk away silently. C, yell at the resident. Or D, tell other staff to avoid the resident. And this is an easy one, so I know you're going to select the right answer. It's easy as far as the test questions involved, but it may be harder for some of you all to set those firm boundaries, but you will have to. You will learn. No one should be touching you inappropriately. No staff person, no patient. So if you are afraid to stand up for yourself, go find a nurse, go find a senior CNA to help you, to teach you the ropes, because we want to make sure that you're not abused in these facilities. So everybody, the answer is A. So you're going to maintain professionalism and dignity while reporting the inappropriate behavior to the nurse, but you're also going to tell the patient, you know, that was inappropriate. Do not touch me there again. And then go let your nurse know. Question 25. Which question is most likely to encourage a resident to talk? Would it be A, are you feeling tired today? B, do you want to wear this outfit? C, what are your favorite foods? Or D, is this water warm enough? And I love you all. Thank you all for studying with me on a Wednesday night. Yes, you have it. So if you chose C, you understand that an open-ended question like what or how encourages conversation and engagement. So you don't want to usually ask questions that can be answered yes or no. Those are called closed-ended questions. And a scenario I'd like to give you is, let's say you have a teenage child who's upset with you and they don't want to talk. And you're like, oh my God, I can't take the silence anymore. Do you want something to eat? Yeah. Conversation's over. So instead, we need to sit down and have dinner together. Would you tell me what you like to eat so that we can have a discussion during the meal? And so now they can't say yes or no. They have to say, oh, I want some chicken, I want pizza, etc. So open-ended questions encourage conversations. Closed-ended questions do not. Thank you all for the hearts. I appreciate you all. Oh, I didn't even ask. If you haven't done so, subscribe to the channel, like the video, and we are so close to having 1 million subscribers. I think we are like 34,000 away. So thank you all. Thank you, thank you, thank you. All right, so question 26. A CNA documents that a resident ate 100% of their meal, but the tray is untouched. This is an example of A, a harmless mistake, B, false documentation, C, miscommunication, or D, an honest error? Yes, it is B, that's false documentation. So don't lie. If the patient didn't eat the food, why didn't they eat the food? Did you not bring the tray into the room? So, you want to go ahead and own up to things, because otherwise, if the nurse finds out, they're going to write you up anyway. So documenting untrue information is a serious offense and could be considered abuse or neglect. So sometimes mistakes happen. I just rather you tell me and we try to, find a workaround. Question 27. What is an appropriate way to promote independence during dressing? Is it A, dress the resident without asking? B, wait for the physical therapist to help dress the resident? C, choose clothes for the resident? Or D, allow the resident to do as much as possible? Remember, the key words were promote independence. And that is right, and you're right, and you're right, and you're correct. I see you, Dozy and Rose and Vanette and Messy. Yes, it is D. So encouraging self-help maintains dignity and muscle coordination. Remember, we need them to be as independent as possible for as long as possible. So we get them to help with their activities. Question 28. Before feeding a resident, the CNA should always A, take their temperature, B, offer them a drink, C, confirm their identity and sitting position, or D, ask if they want dessert. And for this one, I just don't want the correct answer. I want you to tell me the reason that that is so important. And so I see a lot of correct answers. I see so many of them, but why is it C? Why, when you're feeding someone, do you even care about their identity? Isn't a tray a tray? Like, why can't I just give Julio's tray to Mary? Why do you care about verifying their identity? And Elizabeth has it. Elizabeth said, duh, Nurse Eunice, because of the diet. That's right. Because we need to make sure they have the appropriate diet for their conditions, for their disorder. So when you verify the identity, usually whenever the trays are delivered, the trays would also have the patient's name or some type of indicator that this tray goes to that patient, so that we don't make those mistakes and give a diabetic patient a regular tray. Okay, so question 28, the answer was C. Question 29, a resident with Parkinson's disease may need help with which of the following? Walking and fine motor task, blood pressure checks, understanding speech, swallowing air. I was probably sleepy when I put D there. Forgive me. So what concern does your patients who have Parkinson's, what concerns do they normally have? That's right, Anastasia and Veronica and Neil. Let's see, and Yuritsa and May, you have it. So when someone has Parkinson's disease, they usually have like tremors, those fine motor skills. So it's gonna be hard for them to pick up something small. They have stiffness and they kind of walk like a mummy. They have a shuffling walk. So those would be the considerations or the concerns when you're caring for somebody with Parkinson's disease. Sometimes patients will have Parkinson's disease and dementia. But what I don't want you doing is automatically treating a Parkinson's patient or a patient with Parkinson's as if they are demented, because they are usually still within, they're still coherent. It's just that we're rapidly firing questions off to them, and it can take them a while to actually say what they need to say. So when you're dealing with your patient with Parkinson's disease, ask simple questions, give them time to respond before you ask the second question. All right, so great job. Question 30. When providing perineal care to a female resident, always A, wipe back to front, B, skip the rectal area, C, use one wipe for all areas, or D, wipe front to back. All right. And I know you've been watching enough of my videos till you know it's the correct way to clean somebody. That's right. Edward and Louise and Miranda and Messi, we always start cleaning from the cleanest area, which will be the vaginal area if it's a female, towards the most contaminated area, which will be the rectal area. So we're going to do D. We're going to wipe from front to back. And so wiping from front to back prevents the spread of bacteria and UTIs. And if you need to watch those videos, we have perinatal care videos for both females and males on our YouTube channel in our playlist. So when you go to youtube.com/Florida training, just go down. You're going to see like playlists, click on them. We have probably 10 different playlists, but there is one down there with clinical skills. Question 31. A resident with a history of stroke needs to be shaved. What should the CNA do first? A, start shaving the strong side. B, ask if they prefer an electric razor. C, use hot water to open pores. D, tell them to hold still. All right, let's see. I don't see any correct answers yet. So we're revealing a correct response in 5, 4, 3, 2, and all right. So remember, we're trying to keep them independent. We can't really let them shave themselves unless we have an electric razor. So electric razors are safer for residents on blood thinners or with limited mobility. And so when people have a stroke, the stroke could be caused by a blockage in the brain. And if it's caused by a blockage, that patient's going to be on blood thinners pretty much for the rest of their life. And so they're going to be at an increased risk of bleeding. So anytime you have to shave a patient, I don't care what their condition is, one of the questions you want to be asking is there an electric razor? Can your family bring one in? Because that's going to be the safest option for all. Question 32. When trying to communicate with a resident who speaks another language, the CNA should A, use pictures and gestures, B, face them and speak softly, C, repeat the words often, or D, assume head nodding means understanding. That is right, everybody. It is A. And so your facilities will have a communication board. That is nothing more than a laminated sheet of paper that has a picture of a cup of water, a toilet, the Smiley scale where it goes from somebody who is really happy to someone who is crying to help you determine their pain level. And so nonverbal communication tools like pictures and gestures. For example, if it's somebody who does not speak my language, when I come in with the blood pressure cuff, I will say blood pressure cuff and then point to the arm. And I can guarantee you the next time they see me coming in rolling my equipment, because I use gestures, they will have the arm out for you because they now know what that machine is used for. And so whenever you use pictures and gestures, that's another effective technique to help reduce confusion across language barriers. Don't forget, we usually do not have our family members translate important things. So if you're in a room, family members there, you can tell them, hey, this is the blood pressure cuff. Hello, my name is Amelia. I'm the CNA. That's easy. But as far as a nurse or a doctor is concerned, we usually have to use some type of hospital approved translation service to make sure that everything that we're saying, if it's something important, like maybe like pre-op, teaching, that the patient actually understands it, because the family members may not say every word verbatim. Question 33. When using a gait belt, the CNA should stand A, behind the resident, B, on the resident's strong side, C, on the resident's weak side, or D, 2 feet away from the resident. So you have a gait belt. What side do you stand on? All right, revealing the correct response in 5, 4, 3, 2, and we have a lot of C's and a B. Let's see who's right. Ding, 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 ding. It is C. So standing on the weak side provides support where the resident needs it most. Great job. Question 34. If a resident starts choking but can cough forcefully, you should A, begin abdominal thrust, B, pat their back, C, encourage continued coughing, or D, lay them flat. This one's tricky. Let's see how many of you all get this one right. Looks like we have an A, we have a C, we have more C's. We're back to some A's. All right, revealing the correct response in 5. Tanaka said definitely not D. Great job, Tanaka. We are torn between A's and C's, everybody. So let me just give you the correct response. Revealing the response in 5, 4, 3, 2, and y'all, if they can cough, do not perform abdominal thrust. If they can cough, you encourage them to cough. You perform abdominal thrust when they stop coughing. So if they can cough, let them try to clear the airway on their own first. And so that's why you always ask them, are you choking? All right. So if they say yes, they're choking, that is when you would do the abdominal thrust to help remove the obstruction while you're also screaming out for help. And if you can, go ahead and hit that panic device, that code button, the call button, so that the nurse can come in. Question 35. A resident has a new roommate. The CNA should A, introduce them politely, B, leave them alone to bond, C, move furniture around, or D, tell the roommate to stay quiet. None of you all would do any of those inappropriate options. That's right. You are going to introduce them to one another. So the answer is going to be A, courtesy. So courtesy and introductions helps the residents adjust and feel welcomed. Question 36. A confused resident is found licking in the staff refrigerator at 5 a.m., saying that they need to eat before work. What should the CNA do? A, help the resident back to bed. B, ask the resident about their job, and if they're hungry, C, tell them they're not allowed in the nurse's station, or D, remind them that they are retired. Mr. Jenkins is in the refrigerator at 5 a.m. He is eating your food because he's in the staff refrigerator. All right, what do you want to do with Mr. Jenkins? Everybody chose B. Look, even if Mr. Jenkins is confused, his stomach may still be growling. So you ask him about his job. He feels like he has to go to work. Mr. Jenkins, what job are you going to at 5 a.m.? Mr. Jenkins, you're retired. But Mr. Jenkins' stomach is still growling. So Mr. Jenkins, are you hungry? And so the reason why B is the best response is because it's the only one that even cares about his hunger. If you just put him back in the bed, one thing he's going to do is get back up again because he is hungry. So redirect the resident gently by engaging in their reality, because some patients, if they're confused, if they have dementia, you're not trying to agitate them. You can tell them what's right, but they're like, oh no, I got to go to work. So, okay, Mr. Jenkins, you got to go to work. What do you want to eat this morning? Let's try to redirect him. Let's go ahead and feed him, especially if the diet allows him to eat and he's not NPO. And so that will meet their immediate needs for hunger and safety. You get them back in the room, back in the bed. And sometimes we call it sundowners when they get confused whenever the sun goes down. Well, now the sun's about to come up again. So there's hope for the next shift that he won't be as confused. All right, question 37. A resident with an indwelling catheter has no urine in a drainage bag. What should the CNA do first? A, ask the resident to try urinating. B, offer more fluids. C, check the tubing for kinks. Or D, replace the drainage bag. Let's see these new comments. And Christine, Paulin, Babata, yes, it is C. Always check for kinks or blockages first, as this is often the simplest reason for lack of urine flow. And whenever you're checking your equipment, whatever's attached to the patient, remember, we always start off at the patient. So you'll say, excuse me, Mrs. Gertrude, I need to see why there's no urine in your bag. Is it okay if I lift your gown? Because you're starting at the urethra and you're tracing that catheter and the tube all the way down. Because if she is obese, maybe the pressure from her leg could be kinking or occluding the urine stream. Or sometimes your patients are Houdinis and that catheter ends up getting wrapped around their leg. It's not secured anymore. But always start at your patient first and then trace your way down towards the collection bag. 38. A resident who is incontinent of urine has an increased risk of which of the following? Would it be pressure sores, urinary tract infections, dementia, or dehydration? So you have to know what incontinent means in order to answer this question correctly. So a resident who is incontinent of urine, what are they going to be at an increased risk of? Oh, we are torn again between, let's see. I see a lot of B's coming through. Now I'm seeing A's. So someone put in the chat, what is the definition of incontinence? That's going to help you answer this question. What does it mean to be incontinent of urine? I mean, we're half and half, A's and B's, A's and B's. I wish you all could see this. All right, waiting for a response. What does it mean to have urinary incontinence? Yes, Babita, and then yes, Elwood. Hold on, you all are going so fast. So they're leaking urine, so they're wet, right? And then Elwood says no control of the urine. So this person is not retaining urine; they're actually leaking it out. And so if their skin is wet, they are not at an increased risk of a UTI from wet skin. If their skin is wet, they're at an increased risk of pressure sores. So if you chose A, give yourself applause. A patient is at an increased risk for a UTI if they are retaining urine. All right, so this, you have to make sure you know your terms. So incontinence means they're wet. And if they're wet, okay, pressure sore. Great job, team. All right, so A, here's the response. Incontinence leads to skin moisture, which can break down tissue and cause pressure sores if not managed properly. Incontinence does not cause UTIs. The only way a patient can get a UTI from being incontinent if it's fecal incontinence. That means that the fecal matter entered the urethra, into the urinary tract. But you should not be able to get a UTI from sitting in your own urine. You get a UTI from not urinating. All right, so question 39. Which of the following is considered a normal age-related change? Is it dementia, contractures, the bladder holding less urine, or wheezing? Which is normal? Asada said, facts. Love it. Oh, I love studying with you all. So, this is one of my favorite questions. And the reason why it's one of my favorite questions is because we know what the media shows. The media shows that as we age, we're going to become demented. You all, that's not true. There are 100-year-old people who are still sharp mentally. So what happens? Visual changes, hearing changes, the skin changes, the muscles get weaker. Guess what the bladder is, everybody? The bladder is a muscle. And so if the muscle's weak, it's not going to hold as much urine. And that is why when they call you to go to the bathroom, you got to move fast. Otherwise, they're going to have an episode of incontinence. So you all, from this list, the only thing that is normal would be C. So if you chose C, give yourself applause. So with aging, the bladder's capacity decreases, causing more frequent urination. Dementia and contractures, fixated joints, are not guaranteed age-related changes. Question 40. Oh, let me hide myself for this one. All right, so which set of vital signs should be reported to the nurse immediately based on the activity? Y'all, that's a lot. Just put the answer in the chat because I can't say all that. Looks like Jocelyn must have a test. I missed it, so thank you for catching that, Babata. Yes, good luck, Jocelyn. All right. So which set of vital signs should be reported immediately? We have a resting set of vital signs. We have vital signs after eating, vital signs after walking, and vital signs while watching TV. Everybody's choosing A. I need you to tell me which vital sign is abnormal. That's right. Help me teach this class. I love it. So we're torn between A's and D's, but the answer is A. I just need to know why. Which one are you going to come tell me about? Miranda says, Eunice, the respiratory rate is 32 breaths per minute. That is an emergency. That is right, because a normal respiratory range is 12 to 20. So while this person's resting, the vital signs should not be higher. When you're resting, the vital signs should be close to normal, if not normal. So a respiratory rate of 32, that person's hyperventilating. That is who you're going to report to the nurse right away. When we say report to the nurse, you don't leave them. You're actually calling the nurse while you're in the room. So great job for understanding that particular question. And you all, I love you all so much, and I appreciate you all. I just want to remind you that you are taking the right steps for your future, because caring CNAs become caring nurses. So sometimes some of the issues we're seeing is because people just want this degree. They want to be a nurse. They don't know about bedside mannerisms. They didn't take the steps that you're taking right now. So I want you to be very proud of yourself. I am proud of you, and I hope you all have a very good evening. Don't forget, we have all these practice tests. You can go to nurseeunice.com. You can go to fltraining.com. We want to help you succeed. And if you have not shared our information with a coworker or a friend, please do so. We have an online CNA course, which could be taken worldwide. It will not lead to certification, but it's going to help you pass your CNA test. So if you're in a different state outside of Florida, it's just going to supplement your education and your knowledge. And that course can be found on our website too. And then lastly, everybody, thank you for watching. You know I love you all, and I'll see you in the next video. Hey family, guess what? We are this close to having 1 million. Hold up. 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. Hey everybody, good afternoon. This is Nurse Eunice with Florida Training Academy, and in today's video, we're going to discuss 40 challenging practice questions to help you pass your CNA examination. And as we do in each of our videos, we'll give you about 10 seconds to receive your notifications, and we will get started shortly. So hey everybody. So if you're new to our channel, my name is Eunice. I'm a registered nurse. I'm from Jacksonville, Florida. And I want to let you all know, I know you can't see it that well, but today we received an honor from the Jacksonville Housing Authority. We have partnered with them for about 15 years and helped clients who are in low-income housing earn certifications. Some of those clients are now nurses. They've purchased houses. So the goal is to be self-sufficient. And that's what we do here. We teach you how to pass tests. We teach you for free. We call it a borderless classroom. We provide you with education to help you get to the next level. And so if you haven't done so, we do ask that you like, share, and subscribe, especially if you are a returning viewer and haven't done so yet. Before we begin our practice test, I want you to find a quiet space like me right now. I'm in the office by myself. Have paper and pen so that you can take notes. This test is going to be a little more challenging. And so some of the terms may be familiar, but yes, in order for you to pass your CNA examination, you have to know medical terminology. They're going to be asking you questions about patients who have medical conditions. So you have to know about the equipment, the conditions, and the medical interventions or treatments according to your scope of practice. So if you have questions, you can put them in the chat. I'll be monitoring the chat as we go. And looks like we have a lot of comments already. So let me go and look. Kasheen, congratulations. Kasheen says, I want to tell you thank you. I listened to all your videos. I passed my test. And some of the questions you asked were on the exam. Congratulations. So proud of you. And looks like we have another one. Hey, everybody. We have a lot of hellos. And then, all right, so let's get started, team. I'm so happy to have you here. All right, so question number 1. Which of the following suffixes? Remember, prefix comes before a word. A suffix is added to the end of the word. Which of the following suffixes means muscle loss? Is it algia, tomy, phasia, or trophy? This should be an easy one for you all, but they're going to get challenging. All right, giving you about 5 seconds. So we're revealing the correct response in 4,
3, 2, and for everyone who chose D, you got it. So trophy at the end of a word means the lost or wasting away of muscle due to a lack of use, nutrition, or nerve supply. So great job, everybody. Question 2. The body cavity that contains the intestines is D. Is it thoracic, spinal, abdominal, pleural, or peritoneal cavity? Which is the best response? That's right. Pull it forth. Pull it forth. You know where the intestines are located. So we'll give you about 3 seconds to enter the answer in the chat. And Jackie and Todd and a whole bunch of letters that I can't pronounce, and Veronica, Nagasa, yes, it is C. It's the abdominal. So the intestines are located in the abdominal cavity, which contains many digestive organs. All right, here's a medical abbreviation. You will not have a lot of abbreviations on your CNA examination. However, as soon as you pass your test, you need to be looking for a job. And I can guarantee you, when you walk into the hospital, there's going to be abbreviations everywhere in the patient's chart. So you have to start learning the abbreviations. If not now, definitely before you start interviewing. So the abbreviation QOD, as used in prescriptions, means, is it every hour, every 2 hours, twice a day, 4 times a day, or every other day? What does QOD stand for? We're all around the alphabet on this one. We have C's, we have a lot of D's, and I think I saw 2 E's. So we're revealing the answer in 3, 2, and the E's have it. Woo-hoo-hoo. So QID is 4 times a day. QOD is every other day. So the abbreviation QOD stands for, and for all of my students who are trilingual and bilingual, look, I barely speak English. That's all that I can speak. So I'm going to butcher this Latin word. KQ altera die. Yeah, that's what it means in Latin. But for me, for my medical abbreviation, QOD is every other day. All right, question number 14. This one's hard. The pacemaker or the party starter of the heart is the septum, SA node, AV node, left atrium, or mitral valve. Have you taken anatomy and physiology? Do you remember anything that was taught to you when you were learning about the cardiovascular system? So what is the pacemaker of the heart? And because this one's hard, I'm revealing the answer in 3, 2, and Nagasa, you got it, and Gina got it. Yes, Jackie got it also. So I am so proud of you. That one wasn't as hard as I thought because a lot of you got it right. It is the SA node or the sinoatrial node. And so it's at the top part in the right atrium, and so it is the heart's pacemaker. So when it's functioning normally, that's when we get a heart rate that's 60 up to 100 beats per minute. But the SA node is the heart's natural pacemaker and initiates electrical impulses. So great job for knowing that, team. Question 5. Which of the following suffixes refers to pain? Is it phagia, dys, algia, or lysis? All right, we'll give you a few seconds to give us that answer. And I'm so happy that you're here studying with me on a Thursday. All right. We're waiting for a few more responses, and I do see some correct responses. Jackie, Leonie, and Jay, you all chose C, algia, and you are correct. So algia means pain such as neuralgia, which refers to nerve pain. Question 6. The organs of the respiratory system include all of the following except the larynx, the pharynx, trachea, bronchi, or thoracic duct, which is not a part of the respiratory system. Ooh, I got you thinking with this one. All right, I'll give you about 10 seconds for this one.
Didn't need to, because Nagasa and Leone were on it. Yes, it is E. So there is a thoracic duct. However, it's part of the lymphatic system, not part of the respiratory system. So as I said, for this one, it's more challenging. You got to write the notes. And I know you're probably thinking, well, Nurse Eunice, why are you teaching me this? This isn't going to be on my test. Because you have to know anatomy and physiology to make sure that you know how to take care of people. And on top of that, terminology will test, but it's going to be in a phrase of a question such as, how do you prevent incontinence? And if you don't know what incontinence is, you're going to answer the question incorrectly. Question 7, which of the following terms means cell eating? Is it microtosis, phagocytosis, exocytosis, or kinesis? What's the answer, team? What's the answer, team? All right, you're filling the correct response in 5, 4, 3, 2, and yes, I see a few of you all chose B. So when we think about our blood cells, the white blood cells, we say they fight bacteria or they fight infections. That would be phagocytosis. It refers to the process by which cells engulf and digest particles or microorganisms. Question number 8. When we have patients go and do x-rays, a doctor may request for a certain view of a chest wall, an organ, etc. So which of the following is not a body plane? Is it dorsal, frontal, sagittal, transverse, or is it E? They all are body planes. So especially in microbiology, when you're doing your slices, you got to think back. All right, revealing the answer in 3, 2, and Danita, so proud of you. So it's A, dorsal. Dorsal refers to a body direction towards the back, not a body plane. So teaching you something new. There are 3 main planes. So there's frontal, there's sagittal, and then there's transverse. And when we say frontal, we'll also say coronal. So write that down, and you can always come back and watch this video later. I think it's just a good review because you have to learn these terms again, if not for your test, because when you get through taking your test, you're taking care of real people and you have to read real orders. So at least you'll know what the doctor's referring to. Question 9. The suffix kinesia means mind, muscle, pain, touch, or movement. When we talk about kinesthetics or bradykinesia, which is something the patient with Parkinson's disease might have, what are we referring to? All right, you all are going a little bit slow on this one, so I'll reveal the answer in 3, 2, and if there was a test, everybody, I need you studying with Nagasa, Todd, Jackie, Okafor. They're getting these answers right. So I don't know where you are, where you're watching from, if you're nursing students, but you are killing this test, killing in a good way. You're doing great. And so are all of you all. You're doing such a good job. All right, question 10. The abbreviation meaning immediately is it PRN, STAT, QOD, ad lib, or DC? Todd says Michigan. Okafor says Texas. All right, so what does immediately, what is the medical abbreviation? If I tell you to go do something right now, I'm probably not going to say immediately. That's too many syllables. So what's going to be the term? And for all 50 of you who put B stat in the chat, you are right. So the abbreviation STAT means immediately. So I may say, go do a blood pressure stat. That means you drop whatever else you're doing, and that blood pressure is now your priority. Question 11, which of the following is not a type of muscle tissue? Ooh, is it striated, visceral, skeletal, smooth, or patella? That one's easy. Everyone should get this one right. When you think of striated, think about how stretch marks look. So that would be like a striated muscle. So we know it's not A because that is a type of muscle tissue.
So which one is incorrect? All right, revealing the answer in 3, 2, and hold up. I see one of my babies. Hey, Anne Marie. All right, so yes, you have it right. The correct response is going to be E, patella. So the patella is a bone. It's the kneecap. It's not a type of muscle tissue. Question 12. The prefix milli, like in milliliter, does that mean 1,000th, many, 1/100th, or 1/10th? And then adventurer, I want you to look at Read More Nurse, look at Regina's channel, because she does a lot of videos on how people from other countries can come to the US. I just don't know that process, especially given the current administration. I don't want to lead you astray. So Regina, Read More Nurse, look them up on YouTube, look them up online, but they usually have videos that talk about how foreigners can come into the US and obtain employment. Yo, Brittany. Well, congratulations. I'm so proud of you. All right. Great job, girl. All right. So let's keep going, everybody. I hope you have the right answer. And for Volquins and Jana and Christine, yes, you are right. It is 1/1000th. It is A. So the prefix milli in front of something refers to 1/1000th as in millimeter. But for you all, when I ask you to go get the liter of fluid, it's going to be a big old bag of saline. So just think 1/1000th of that would be a milliliter. And you're welcome there, adventurer. All right, question 13. Which term describes the opposite of being unconscious? Is it sedated, oriented, alert, or asleep? What is the opposite? Let's see if you know. I'll give you about 5 seconds. You got it. You got it. You said alert, and you are alert. You're with me right now. So alert, the answer is C. A patient who is alert is fully awake and responsive, which is the opposite of being unconscious, where the patient is unresponsive to stimuli. Remember, when you tap and you shout, as long as the person is still breathing, you can try to do a sternal rub, depending on what your facility's policies are. But at any point your patient is unresponsive, of course, that's an emergency. You're hitting that code button at the top of your bed. Usually we do not use the call bell for emergencies because that's a slow way to get help. You want help in there quickly if your patient's unresponsive. Question 14. Oh, this one's long. Legally, a physician, A, may not refuse treatment in an emergency situation. B, may refuse to provide follow-up care after initial treatment. Which of these? Only one is correct. C, must provide diagnosis to a patient's employer if requested. D, must provide a medical history to the patient's insurance company if the insurance company requests it. Or E, may choose to accept the patient if he or she chooses. So only one of those is accurate. Legally, what can a physician do? And so there are different laws, kind of like there is a Good Samaritan law. There's also an EMTALA law. So if there's an emergency and that patient gets to the hospital, they get to the ER, they have to be treated. We cannot refuse to treat a patient, even if they don't have insurance. So physicians are legally obligated to provide emergency care regardless of personal choice. And so we have to stabilize that patient. We can then send them somewhere else once they're stable, but we cannot refuse to take care of somebody during an emergency. 15. During a nurse says, let's use cluster care for Mr. Adams so that he can rest. What should you do? A, provide only hygiene care and skip the rest. B, plan all the tasks at once to minimize disturbances. C, document care every 30 minutes. D, spread out care over the shift so nothing is missed. Or E, all of the above. So the key term is cluster care. What does cluster care mean? All right, revealing that answer in 3, 2, and Christina, and I think it was someone else, but Christina definitely was the first one with the answer. Cluster care is we're going to do pretty much all the tasks that we can at one time. So we can stop running back and forth. And so we can stop inconveniencing this patient who just wants to sleep. So cluster care means grouping tasks like vital signs, repositioning, and hygiene into one visit to reduce the frequent interruptions and allow the patient more time to rest and recover. Plus, it's just better time management for you and I as caregivers. Question 16. You walk into a room and you see a patient struggling to breathe and turning blue. You press the call light, but no one answers quickly. What should you do next? And I just gave this answer, by golly, by mistake. Is it A, wait for your assigned nurse? B, call housekeeping to help? C, activate the rapid response team? D, begin charting the event? Or E, leave the patient and go find the nurse? And I have happy nurse tears over here because all of you all are going to save our patients because all of you all chose C. That is right. You're going to hit that code button. It's okay for a CNA to activate the rapid response team. So hopefully that will get your nurse into the room. Of course, you can scream out. You're going to verbalize and say the word help. But that button, whenever you press that one, it alerts throughout your floor. So it's just not the nurse's station where the secretary is going on lunch break and right now is unmanned. So the whole floor is going to know that there is an emergency happening in your room. That's everybody in there so that your nurse and, if necessary, the rapid response team will come to you. So usually that's right above the patient's bed on the wall. Question 17. You are assigned to a patient with a DNR order. During care, the patient becomes unresponsive and has no pulse. What is your immediate responsibility? A, begin CPR immediately. B, call the family and notify them. C, call a code blue and begin chest compressions. D, begin post-mortem care before rigor mortis begins. Or E, notify the nurse without starting CPR. Remember, this patient has a DNR order. Have to know what the abbreviation DNR means. All right, everybody, you have it. It is E. We're going to be chest compressions on someone who has a DNR order, and you cannot just put somebody in a body bag, start mortem care without the nurse doing an assessment and without a physician pronouncing death. So it's going to be E. You're going to notify the nurse. You're not going to start CPR. The nurse, that's right, Leonie, do not resuscitate. The nurse will then do his or her assessment and notify the appropriate person. So a DNR means no CPR should be started if the patient stops breathing or has no pulse. CNAs and PCTs should alert the nurse immediately and follow the care plan. This is a long one. Question 18. When assisting a nurse with patient care, you overhear that the patient is now a full code. What does this mean? The patient should not be disturbed. The patient refuses medication. CPR and all life-saving measures should be performed if needed. The patient can now eat a full meal or bring the crash cart and place it outside of the room door. Full code. What does that refer to? And it's like the last one, even my tough questions are not tough for you all because you are super smart. So a full code means that the patient has chosen to receive all possible resuscitative efforts, which include CPR, the shock ventilation, also intubation if they need an advanced airway. And that would be of a cardiac arrest. Question 19. The principle that ensures a patient knows the risk, benefits, and alternatives before agreeing to a treatment is called, is it confidentiality, informed consent, competency, or autonomy? All right, all right. So we're torn between B's and D's. All right, so D means they can make their own decisions, but B, I need to start an IV on you. The complications could be possible bleeding or infection, but I need to start this IV so that I can hang your blood product because your hemoglobin or your red blood cell count is low. So I am giving this patient the information they need so that they can determine whether or not they're going to agree with treatment. And so that is what we mean by informed. So yes, you chose B. You're absolutely correct. We're going to give that patient information so they can make an educated decision about their care. Question 20. A CNA is caring for a patient who speaks limited English. To help the patient understand bathing instructions, the CNA uses her personal cell phone to access a free translation app. Which rule or guideline did the CNA likely violate? Is it A, the CNA failed to complete charting in a timely manner? B, the CNA violated infection control policies? C, the CNA acted appropriately by taking initiative? Or D, the CNA used an unapproved method for patient communication and breached confidentiality? And yep, you all got it. So we do not use our personal cell phones in order to translate anything. The answer is D. When you're in your place of employment, while you do have good intentions by trying to find a way to speak with a person who has a language barrier, using personal devices or unapproved translation services can lead to HIPAA or confidentiality violations and inaccurate communication. Facilities typically require the use of hospital-approved medical interpreters or certified translation lines to protect patient privacy and ensure safe communication. So you would, bring that issue up to the nurse who would then work with you to find someone who can help translate for that patient. Question 21. Your long-term care facility recently experienced a flu outbreak. One of your patients has a mild cough but no fever. What should you do before entering the room? A, skip PPE because there's no fever. B, wear full PPE, including gloves, gown, mask, and face shield. C, just use hand sanitizer. Or D, enter quickly to limit exposure time. Yo, son, so proud of you. Thank you so much. And congratulations on passing your test. And of course, coming back and still studying with us, even though you are now a PCT. Perfect. In this question, you don't necessarily have to put on a face mask unless your facility shield, unless your facility requires it, but you're definitely going to put on some PPE. So the answer would be B. Even mild respiratory symptoms can be contagious, especially in vulnerable populations such as long-term care facilities. So follow facility protocols during outbreaks. But again, I have you wearing a full face shield, but we don't need you contracting something because then you're going to about the rest of the hospital. So put on your PPE and perform hand sanitization and hygiene as often as possible. Question 2. Oh, Mazine, we are praying for you. We know that you're going to do well on your test, and thank you for studying with us. So you all give Mazan, I think I mispronounced your name, some well wishes. All right, so question 22. Hey family, guess what? We are this close to having 1 million, 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. During a cyber attack, your facility's charting system is offline. A nurse asks you to continue documenting vital signs on paper. What is your responsibility as a CNA? Only if you're asked to. B, skip documentation until the system is back. C, document vitals on the assigned form legibly and accurately. Or wait and memorize the information for later entry. And this has happened a lot recently where cyber attacks have knocked hospital systems offline for days, if not weeks. So what would you do if you could not document with or on a computer? And so for everybody who has C, you are right. You are going to use the provided documentation form. In the event of system outages, paper documentation becomes essential. So CNAs must record observations clearly and promptly to ensure continuity of care and for legal accuracy. So don't try to wait to the end of your shift to document, because you may forget something. And there are cases now recently where CNAs are also getting charged because you're documenting that you're turning patients, etc., but then the patients end up with bed sores. So if you are at a facility that has a large amount of patients and you cannot provide the care for those patients, you probably want to document that you did not turn the patient because you didn't have enough help and you want to be looking for another job, because now you are going to jail and you're losing your CNA licenses. So just think legally. If you didn't do something and you document that you did, you're also creating another type of crime, because they call that stealing time. All right, so question 23. Excuse me. Oh, this one's easy. What does the term tachycardia mean? Is it slow heartbeat, fast heartbeat, irregular heartbeat, or absent heartbeat? And Okafor, I have not yet created a way, because I have thousands of these tests. I will be able to work on that in June, and I hope you haven't taken your test by then. But I do want to find a way where I can just repurpose all the questions that I've created on slides so that I can help you pass your test that way. But if you go to our website, which is fltraining.com, click on resources. From resources, it's going to say links. Or you can go to fl.com/links. Once you click on that image, it's going to take you to another website. And at the bottom, I have free practice tests. So I'm just going to repeat that. fltraining.com/links. Click on the image, go to the bottom of the next site, and you're going to see free CNA practice tests that are printable. All right. So everybody, if you chose B, you are right. So tachycardia, tachycardia means fast. Tachy means fast, and cardia refers to the heart. So tachycardia would be a fast heartbeat. Question 24. When assisting a resident during lunch, the patient suddenly begins coughing, has trouble breathing, and is scratching at their throat. That's what you need to remember. They're scratching. Why would someone be scratching? You hear wheezing, but they are not turning blue, and they can still speak. What should you suspect, and what's your next action? A, the patient is choking. Perform the Heimlich maneuver immediately. B, the patient is experiencing heartburn. Offer water. C, the patient may be having an allergic reaction. Notify the nurse immediately and monitor for signs of anaphylaxis. Or D, the patient is sleepy. Encourage rest. So we have somebody who's coughing, having trouble breathing, they're scratching at their throat, and they're wheezing. What do you think, team? Sounds like an allergic reaction to me. It is C. Great job. So anaphylaxis can mimic choking, but often includes wheezing, itching, rash, or swelling, not just airway blockage. If a patient is wheezing, can't speak, and is showing signs of allergic reaction, this may be anaphylaxis, which requires immediate nursing and possibly emergency interventions such as epinephrine, or for short, if you're in home care outside of a hospital, we'll say EpiPen. But if you're in the hospital, your nurse would actually have access to IV epinephrine. And I think someone just left oh, Helena, I saw your message about you passing your test. I do apologize. I missed that. And there are so many comments. So there was somebody who had a question. I'm trying to look at your comment now, but there are a lot of comments here. So just bear with me. I think you have failed your test twice. So I do want to address that. Okay, there we go. Thank you all for your patience. We're trying to help everybody pass. Oh, yes, but while you're waiting, Okafor, what I want you to do is I want you to, we do have a medical terminology download that's on our links page. I need you to look at every one of those terms. You have to know those terms, because if you're failing your test, it's more than likely because you don't know medical terminology. So that's what we'll start with before you start practicing questions. All right, so question 25, and we're going all the way to 40. So thank you all for bearing with us and for studying. Question 25.
You're assisting in a patient room when the patient suddenly clutches their chest, complains of severe pain, and appears ready and short of breath. The nurse says, "We may be dealing with an MI." What is happening? A, the patient is having a cardiac arrest and needs CPR. B, the patient is having a stroke. C, the patient is choking and needs the Heimlich maneuver. Or D, the patient is having a heart attack and needs immediate nursing and medical care. So let's go back and let's read that. Severe pain in the chest, they're sweaty, and they're short of breath. We know it's related to the heart, but what are you suspecting? And as a CNA, you don't diagnose, but you need to know when to get that nurse in the room, and you need to know what to do until the nurse gets into the room. So for this one, what is the best response? And for everybody who chose D, you are 110% correct. So an MI is known as a myocardial infarction. So myo being muscle, cardio referring to the heart muscle, infarction means death. So part of the heart is dying. That's what we mean when we say a patient's having a heart attack. When a patient's having a heart attack, they're still talking to you. They feel like death, but their heart is still beating. They're still communicating. They're sweating. They're having chest pain. That's totally different from cardiac arrest. Cardiac arrest involves the loss of consciousness. There would be no pulse. There's no breathing. And that is when you would be performing CPR. So if you think about the heart as a house has plumbing and it has electricity. When the plumbing gets backed up, that would be a heart attack. We go in, we clean out the arteries. They're going to be discharged home in a day or two. Cardiac arrest, the lights went off. That's when we have to use that defibrillator. We have to use energy to correct the electrical issue within the heart. That is the person who's going to need CPR. So that's how I want you to think about it. MI or heart attack, plumbing. Cardiac arrest, electricity. One requires CPR. The other one just requires a great response from the nursing team that does not include CPR. All right, question 26. You walk into a patient's room and find a large amount of bright red blood on the bed. The patient is pale, weak, and says, "I feel dizzy." What is this most likely a sign of? Is it deep vein thrombosis or DVT, hemorrhage, anemia, or hypertension? I'm making you learn these medical terms today, baby. We're going to be some great professionals in healthcare. We're going to understand our terms so that we sound intelligent when we speak to our colleagues and also to our patients. And so if someone has a large amount of blood that has escaped their body, they're hemorrhaging. So that's right, Travis and Christine and Kimberly, and I think it was Jackie. Yeah, that's hemorrhaging. So hemorrhage is active, uncontrolled bleeding, often visible and accompanied by dizziness because they don't have any blood flow to their brain, signs of shock. Meanwhile, a DVT is a blood clot that's often in the leg and does not cause active external bleeding. So you all, let's talk about somebody who has external bleeding. I want you to put it into the chat. What are you doing while you're waiting for the nurse to come into that room? Your patient is bleeding, pale, and they're dizzy. Do you keep them sitting upright? Do you just let them? What are you going to do until your nurse gets into the room? Let's see what comments you all have. Yeah, because it happens. That's right, Veronica. Oh, I messed it up. I'm glad to see you, Wiseline, also. So Veronica and Jana said, we're applying pressure. That's right. You're gloving up. You're applying pressure. It doesn't matter that you don't have sterile gauzes and all this other stuff. You have sheets and you have towels and you have blankets. You go ahead and you apply pressure. Of course, you're going to make sure that you have your gloves on hands and have that patient lay down. Don't have them sitting up if they're hemorrhaging because it's just going to make their blood flow to their brain be less. And it's also because of pressure can make more of the blood come out. So if they are hemorrhaging from an arm or a leg, you can always elevate that extremity. That's a great job, Kim. I'm so proud of you. Question 27. A patient turns their head, covers their mouth, and says, I feel sick to my stomach. You grab an emesis basin, but they have not vomited yet. What is the best documentation term for their current condition? Nausea, emesis, reflux, or indigestion? And my system is going slow. Lately, there has been a lot of Wi-Fi issues. I don't know why. It doesn't matter from home if I'm at the office or even Miss Jackie, and she's all the way in Illinois. So we're not sure what's going on nationwide with the Wi-Fi, but it's taken me a few moments to actually see your comments. So I do apologize for the delay. All right, so question 27. If you chose A, you are right. They haven't vomited yet. Right now, they are nauseated. So nausea is the sensation of needing to vomit, while emesis is the actual act of vomiting. It's important for CNAs to document symptoms accurately. So if a person has not brought up any secretions or stomach contents, you cannot say that they have emesis or that they vomited. If they only feel sick to their stomach, the correct term would be nauseated, or they right now are nauseous. Question 28. A patient suddenly vomits large amounts of undigested food and stomach contents. You assist them, provide oral care, and report it to the nurse. What is the correct medical term for what just occurred? Would it be reflux, emesis, hemoptysis, or nausea? And I just gave you this answer, so all you all need to get it right. All right, so they vomited a large amount of undigested food. And now you have to document in the chart. What word would you use? We're torn between A's and B's. Oh, I tricked you all. So when someone has GERD or gastric reflux, they may have a painful sensation, a burning sensation. It may come up, but usually swallow it back down. So that would be reflux. It did come up, but it didn't necessarily come out. Once someone starts vomiting and the stomach contents are coming out of their body, that would be emesis. That's right, like Diamond. Reflux is a burning sensation. So acid is coming back up, but this was undigested food and stomach contents. So the correct response is B. And when you're documenting, you should document in detail the color, the amount, the odor, the fact that it had food particles, and you're also going to report it to the nurse. And you want to take that food out the room too when you leave, because that person should not continue eating because right now their stomach is too upset. We need to give it time to rest. Question 29. While assisting a bedridden patient, you notice their feet are pointing downward and they are unable to flex their toes. The nurse mentions preventing foot drop. What is the best action a CNA can take to help prevent this condition? Is it A, place ice packs on the patient's feet to reduce swelling? B, massage the toes frequently to encourage circulation? C, use footboards, or position the feet with pillows to maintain a neutral position? Or is it D, elevate the legs above heart level for long periods? Excuse me. So one of the key terms is foot drop. How do you prevent foot drop as a CNA? And for all of you who are choosing C, you are absolutely correct. We're going to put something against their feet to prevent the foot from dropping. And so hopefully my camera will work and not slow down the chats too much. But we have a patient who's maybe they're paraplegic, or they have been in the bed for a while, or let's say they had a stroke, and on the side affected by the stroke, their foot is starting to drop. So what you want to do is you want to put a board or something against the foot in order to keep it upright. Of course, if you have physical therapy there, they should have some braces or some type of device, but you are the CNA. You saw it first. Let's put a folded pillow or something, put it against their foot until you can notify the nurse, who will then get an order for PT from the doctor. And so you all, I don't think I'm going to be able to show my face much more on the screen because of the delay. So I do love you all, but from here on out, it's just all words. All right, so let's go to question 30 as soon as my system catches up. All right, so we said that was C, and now we have question 30. A nurse asks you to collect a urine specimen. You're unsure if it should be a routine or clean catch sample. What is the main difference between the two? A, routine specimens require sterile gloves. Clean catch does not. B, clean catch specimens require sterile gloves. C, clean catch specimens are only collected from Foley catheters. D, clean catch specimens require perineal cleansing and midstream collection. Or E, clean catch specimens are, it says the same thing again, are only collected from Foley catheters. So for this one, disregard E and choose the best response from A through D. And that's right, out with Kai and Jana and Leonie and Kristen, Danica and Miss Bonita. You all have it. It is D. So sometimes they'll have little wipes that they can use to wipe before they start urinating. And then they need to initiate their stream, and they would have the cup available, and they would put the cup down to collect the urine midstream so that we don't get a whole bunch of bacteria in the cup. So a routine urine specimen can be collected anytime and does not require special prep. What would be a routine urine specimen? A pregnancy test. You don't have to do a clean catch for a pregnancy test. However, a clean catch requires cleaning the peri area first and collecting midstream urine to reduce contamination, and that's usually for culture testing. Question 31. The main body part involved in the metabolism of drugs is, would it be the stomach, kidney, small intestine, large intestine, or liver? All right, and this is important because we're giving these patients a whole bunch of medications. And if this person has a particular organ impairment, that means that they can build up a toxicity of that medication because it's not being metabolized. It's not leaving the system. And so I know a lot of you all want to choose B, the kidneys, but for Mazan and Wiseline and Nagasa, it is E, you all. The liver does metabolism. The kidneys do the filtering and the excretion. So the liver is the primary organ responsible for the metabolism of drugs, breaking them down into forms that can be easily excreted by the kidneys. All right, so question 32. Which of the following thermometers is considered the most accurate indicator of body temperature? Is it oral, or tympanic? Everyone repeat after me. Axillary, not auxiliary, axillary. D is rectal, and then E is both A and B. Not the one that's the most common, which is the most accurate. All right, giving you about 5 seconds. So we'll reveal the correct response in 3, 2, and it is D, rectal. So the rectal thermometer is the most accurate for core body temperature because it provides the least variability due to external factors compared to other methods. So we're getting a core temperature that is not impacted by the coldness of the room, by the person drinking hot fluids by them smoking cigarettes or eating something cold. So usually you'd only do a rectal temperature when your patient was extremely sick and or hypothermic. That's usually done in the ER or the ICU. And so that's usually more for PCTs and or those who have emergency experience. So you'll learn that in the future if that is part of your job requirement. Question 33. Oh, it's going slow again. But thank you all for your patience. All right, there we go. Question 33. A CNA is asked by a busy nurse to assist with a sterile dressing change. The CNA begins opening sterile gauzes and prepares to touch the sterile field. What should the CNA really do? Is it A, continue with the dressing change as long as they wear gloves? B, perform the task if no nurses are available? C, stop and inform the nurse that sterile procedures are outside of their scope of practice? Or D, use clean technique instead to save time? And when you choose this answer, I have a story to tell. And so many of you all chose the correct response. It is C. So you're going to stop and inform the nurse that that's not within your scope of practice. Sterile technique, whenever you're taking your CNA examination, sterile technique is not something that a CNA can perform. Once you're in the hospital and you are trained as a patient care tech, they will sometimes teach you sterile technique because you insert catheters. So if you do something internal or invasive, that will be sterile technique. As a CNA, when you're taking your test, remember you do not perform sterile technique. So sterile technique involves maintaining a field completely free of microorganisms and is not within the CNA scope of practice. CNAs may assist by gathering supplies or providing comfort measures, but only licensed nurses or trained professionals should perform sterile procedures and prevent infection. All right, so you all, I used to watch this TV show, and there was a lady who was gossiping, and she was like, "Ooh, you ain't hear this from me." So, "Ooh, you ain't hear this from me." But there was a nurse who pulled out pills at a nursing home and put the pills on the patient's bedside tables, and then went to the CNA and said, "Hey, I'm gonna go home, take a nap." You got me, right? That CNA did not have her. That CNA called the house supervisor. That nurse lost her job, and she probably should be losing her nursing license. So I don't care how cool you and that nurse are. At no point will you step outside of your scope of practice and do something that a nurse should be doing, because you can be sued and you could be held liable for helping that nurse steal time and or cause an injury to a patient. So kudos to that CNA. All right, so question 34. How do you all feel about that? I know sometimes we want to help our buddies, but a nurse who went home and just left a task for a CNA, I put the pills on the bedside table, make sure everybody takes their pills. Absolutely not. All right, so question 34. While turning a stroke patient with hemiparesis, all right, so let's say that word together, hemiparesis, the CNA is asked to evaluate muscle strength. What is the CNA's role in this assessment? A, perform a full strength grading scale and report results. B, document strong or weak based on professional opinion. C, observe and report inability to move or grip during care. Or D, assign a mobility score and write physical therapy goals. For this one, I'll take one or two answers because they're kind of similar. But definitely don't step outside of your scope of practice. And because this one's a little bit easy, as soon as my system allows me, we're going to skip to the next question. So I'll reveal the answer in 3, 2, and come on, system, you can do it. All right, we have a lot of C's in the chat. We're just waiting for our system to show us the correct response. But a lot of people put C. Leonie, we would not do D because you would not be writing physical therapy goals. That would be a nurse's duty. And so everybody, the answer was C. So if you chose C, great job. Question 35. In which of the following positions used for examination of the rectum does the patient lie on the left side with the left leg slightly flexed? And so if, let's say, we think the patient has a prostate cancer, remember, you as the CNA, you do positioning and you provide comfort. But that position has a name. So is it Sims, prone, lithotomy, dorsal recumbent, or Trendelenburg? They're lying on their left side with their left leg slightly flexed, aka bent. And so many of you all got that right. That would be A. It is the Sims position. And a Sims position would also be utilized for enemas. So if your nurse says, hey, I'm going to be giving Mr. Lucas an enema, your questions are, how soon? Because you need to know how much time you have, because you have to go in that room and prepare that bed. What do I mean by prepare the bed? You got to put some extra disposable pads down, because that enema is going to come out. And do you want it coming out all over your sheets in case you're not there in time with a bedpan? So the Sims position is used for rectal examinations and enemas, as it provides access to the rectum while ensuring patient comfort. All right, question 36. And thank you all for staying with us this long, because we're going all the way to question 40. And I just appreciate you all so much. Which my system would act right. We only got a few more slides left. There we go. Question 36. The artery most commonly used for taking a patient's pulse, would it be the carotid, apical, temporal, celiac, or radial? When you're taking a patient's pulse, which pulse are you feeling? All right, we have A's and we have C's. Any other responses? All right, revealing the answer in a few moments. Let's see if we get any other responses. So I'm going to tell you that it's not A, because it says commonly. We would only be feeling for a patient's carotid pulse during an emergency, when you're tapping and shouting and your patient is unresponsive. That is when we would be feeling for a carotid pulse. So think about when you're doing the pulse scale. What is the name of the pulse or the artery that you'd be feeling? So give me some new responses since it is not A. That's right, May and Farida and Okafor and Veronica. It is E. It is the radial pulse. So the radial pulse is located in the wrist. And I'm just going to pull the questions up on my phone because this system has such a delay. But the radial pulse is located in the wrist. And remember that when you're taking a pulse, especially during your CNA examination, you have to count the pulse for 1 full minute. If you lose count, you would let your nurse know that you lost count so you can start over again. And we never take our the radial pulse or any pulses with our thumbs, because our thumbs have their own pulses also. So you feel for the pulse with your index and your middle finger. All right, I pulled this up on my phone so that I can still at least maybe read the questions to you because it's going so slow on this computer. All right, question 37, even though you can't see it on the screen just yet. Which of the following respiratory terms means difficulty breathing? Is it bradypnea? I cannot pronounce that word, but I pronounce so many other words, so don't judge me. Is it orthopnea, dyspnea, or is it apnea? So the PNEA refers to breathing. So which prefix refers to difficulty? Yep, if you chose C, dyspnea, you have it correct. So dyspnea refers to labored or difficult breathing, often a symptom of respiratory or cardiac conditions. Question 38. The absence of respiration for periods lasting more than 15 seconds. Is it called, and then we have the same or similar responses, bradypnea, hyperpnea, shock, Cheyne-Stokes, or apnea. So you have to know the prefix that means absent. All right, let's see what you have. Let's put it in the chat. And yep, if you chose E, apnea, you're absolutely correct because the prefix A or an means the lack of. So apnea refers to the absence of breathing, which can occur during sleep or as a result of medical conditions. So if your patient has an irregular breathing pattern, you are to count their breaths for 1 full minute. When you take your CNA test, you have to count the breaths for 1 full minute. I know once you're in the facilities, they want to, you want to cheat a little bit. You want to count the breaths for 15 seconds and or the pulse, and then multiply that number by 4. But if a patient has an irregular heartbeat, pulse rate, AKA, or a regular breathing pattern, you want to count for a full minute because if it's irregular, you can't be multiplying. You're going to give us the wrong number. Question 39. You are present when a patient is unresponsive. The physician arrives, listens with the stethoscope for a full minute, and then says the time of death is 10:34 a.m. What did the physician most likely assess to declare death? Was it the patient's temperature, the patient's pupillary reaction, the apical pulse for 1 full minute, or the oxygen level using a pulse oximeter? So how does a physician determine the time of death? Trick question. Tricky. All right, I'll give you about 10 seconds to answer this one. And Eltina, and you have it. Yes, you all. So they're going to put ears to the chest. They're going to listen to the apical heart rate. And when they don't hear anything, they're listening for 1 full minute. That is when the physician would pronounce the time of the death. So the nurse can tell the physician, hey, our patient in room such and such, we coded them, we've been coding for a few minutes, or their DNR, I listened to the chest, and I listened to the apical pulse, and there was no heart sounds. So for some physicians, they will take a nurse's word for it. Other physicians are going to come in to do their assessment, and whenever the physician does their assessment, that's when they will pronounce the time of death. So physicians confirm death by listening to the apical pulse at the heart for a full 60 seconds. The absence of heartbeat and respirations confirms clinical death. CNAs may be present, but they do not pronounce or confirm death. Question 40. I'm going to start reading it before it shows on the screen. A CNA is assigned to a confused patient with dementia who is combative during a bath. The patient hits and yells at staff. What is the best initial action for the CNA? A, leave the patient and refuse future care. B, restrain the patient and continue bathing. C, stop the activity, ensure safety, and try again later using a calm voice. Or D, ignore the behavior and proceed quickly to finish. All right, you're bathing someone who is confused with dementia, and they become combative while you are trying to give them a bath. At that point, safety is your priority. The bath is not. So which of the responses helps to keep both you and your patient safe? And that is right. If you chose C, you are absolutely correct. We're going to stop the activity, ensure safety, and try again later using a calm voice. Great job, team. And so as we say at the end of each of our videos, we want you to remember that caring CNAs become caring nurses. You all are doing it the right way. You're starting at the bottom. You're going to work your way to the top. And this time is going to pass regardless. So you're going to be learning terminology. You're going to be learning how to actually communicate with patients and staff. You're making your nursing school journey so much easier by being a CNA or a PCT first. So I want to thank you all. If you have not subscribed to our channel yet, I ask that you do so. And I'm going to apologize. numerous times for our Wi-Fi issues. I wish I could fix them, but I think it's just something going on nationwide. It's not just specific to our office or my home, because it seems like each video we're having more and more difficulties. But I do appreciate you all, and if you have not yet done so, please like the video, subscribe to our channel. I'll be posting another video in a few hours that talks about doing a skin assessment on a patient so we can do pressure ulcer prevention. Question number 1, team. A resident begins to choke while eating and cannot speak or cough. The nurse aide should do which of the following? Is it A, offer water to help the food pass, B, call the nurse and wait for help, C, pat the resident on the back, or D, begin abdominal thrust immediately? They began to choke while eating and they cannot speak or cough. And I love how encouraging you are to each other in the chats. That's what I'm talking about. That's that future nurse energy. And I'm going to be revealing the correct response in 3, 2, and that's right, everybody. If they cannot cough, if they cannot speak, it is a medical emergency. You're going to perform those abdominal thrusts, previously referred to as the Heimlich maneuver. If they can cough, you encourage them to cough. But in this case, the person could not cough or speak. So you have to jump into action while you're also screaming out for that nurse. Question number 2. A resident who is visually impaired requests assistance finding their cold light. The CNA should A, tell them it's next to their pillow, B, place it in their hand and explain its function, C, ignore the request if the resident seems fine, D, turn on all the lights in the room. How do you assist a visually impaired resident or client? All right. Are you all able to hear me? Because we have one person saying that they cannot hear any sound. So if you can hear me, give me a thumbs up. All right. Cool. And yes, if you chose B, you are absolutely correct. All right. Question 3. Which vital sign change should be reported immediately? Thank you, Ms. Lane. Thank you, Tanaka. Is it going to be A, an oral temperature of 98.9, B, a blood pressure of 120/80, C, a respiratory rate of 8 breaths per minute, or D, a pulse of 76 BPM, stands for beats per minute? So if it's respirations and you see BPM, that stands for breaths per minute. But if we're talking about the pulse and you see BPM, that stands for beats, how many times the heart is pumping per minute. And I see so many correct responses coming through. So we'll be revealing the correct response in 3, 2, and yes, everybody, correct response is C. It's okay, Unicorn, if this always confuses you. So a respiratory rate of less than 12 would indicate that the patient is breathing slower than normal. You want to, of course, try to stimulate the patient, try to wake them up while you're calling for the nurse. So you have to know your normals as a CNA. If you don't know your normals, you won't be able to let the nurse know if something is abnormal. So make sure you study those vital signs. And if you look at the very bottom of the screen, you have our website, which is fltraining.com. You all, under our resources tab, we have a free vital sign study guide. So there's no reason for you not to know this information. You got to know it. You got to learn it so that you can become a safe caregiver. Question 4. When documenting care in the medical record, the CNA must A, use only red ink for accuracy, B, erase errors completely and rewrite, C, record observations objectively and in ink, or D, record observations subjectively and in ink. Let's see if you can get this one right. I have faith in you. I know you can do it. All right. I see so many correct responses coming through. I am so proud of you. Yes, everybody. It is C, baby. It needs to be factual. It needs to be objective. It needs to be what you saw, what the patient stated, not subjective, not what you felt. So question 5. A resident with Alzheimer's begins to wonder, what is the best action for the CNA?
A, lock the resident in their room. B, follow the resident and redirect them calmly. C, scold the resident to stop walking. Or D, restrain the resident in a wheelchair. Now, what do you know about Alzheimer's patients? What do they do all day? That's right. They wander, they walk. Your job is to make sure that they wander and walk safely. So the correct response is going to be exactly what you chose. It is B. That's right. So redirection preserves dignity and safety without using restraints. Question 6. When applying a gait belt to assist with ambulation, the CNA should A, fasten it snugly around the waist over clothing. B, apply it loosely over bulky clothing. C, place it under the resident's arms. Or D, tie it in a double knot. And so that CNA kit that I was telling you about that we have available in our Amazon store, it includes a gait belt. You also practice these skills. And if you are having a hard time passing the written, okay to have an audio test where the computer will read the questions and the answers to you so that you understand the terminology. And so everybody, I want you to pass your test regardless of what resources you use. And so for question number 6, if you chose A, that's right. We're going to keep it snug. 2-finger check. Anytime you put something on the patient's body, whether it's a restraint, that ensures that there's enough room for circulation and blood flow. So if you knew that, give yourself applause. All right, question 7, you all. Which statement best describes standard precautions? A, used only for residents with visible signs of infection. B, required only when handling food. C, infection control practices used with all residents. Or D, applied only in isolation rooms. And you all, we have more people who are saying they can't hear us. I'm not sure what's happening, so I'm going to ask that they please sign out and join again, because obviously some of y'all can hear us because you gave us thumbs up. All right, so everybody, for question number 7, ding, ding, ding. Yes, standard precautions would be C. We're going to assume that all bodily fluids and blood is infectious and that we should treat all residents the same to prevent disease transmission. Question 8, which of the following is an example of a psychosocial need? Break those words up. Psychosocial. Would it be clean linens, nutritious meals, adequate hydration, or emotional support? All right. I see you, Monka. I see you, Christine, Yvette, Danita. Yes, you got it right. Louis and Joseph, it is D. So psychosocial needs involve mental, emotional, and social well-being. Question 9, and we're going all the way to 40 questions tonight, team. So question number 9, the CNA notices that the hands of a resident with Parkinson's disease are trembling during breakfast. What should the CNA do? A, ignore the tremors. B, offer assistance with feeding. C, take away the utensils. Or D, call the resident's family. And what I'm doing now is making sure you understand what are some of the common signs and symptoms with certain disease states. So we know that if a person has Alzheimer's, they should like to wander. Our job is to not tie them down, it's for them to wander safely. And a person with Parkinson's disease, they have tremors. That's what they have. And so we need to encourage independence. So the answer is going to be B. So even though they are trembling, you're going to be patient and you're going to provide assistance to allow the resident to not only be able to feed themselves, but to maintain their dignity. Remember, if you try to do everything for them, you take away their independence, and sometimes your patients become angry at you because you're not letting them do anything. You're like trying to do everything for them. Or the opposite extreme is that they allow you to do everything and then they become more dependent upon you. And when the next CNA comes, she may not have that much time. So we want to keep them as independent as possible for as long as possible. Question 10. When feeding a resident who is sitting in bed, the bed should be at what angle? Is it A, any position a resident prefers, B, 30 degrees, C, 45 to 60 degrees, or D, 60 to 90 degrees? Reveal the correct response in 3, 2, and yes, it is D. And I'm seeing some new names. So, hey, new family members, it is D. So 60 to 90 degree angle helps to prevent aspiration while eating by allowing gravity to assist with the swallowing. So we're going to sit them up. And then after they get through eating, you all, we don't lay them back down because we're smarter than that. After they get through eating, what do? We can lower the bed a little bit. So maybe we'll take it to a reclining position about 45 degrees. But we do not lay anybody flat immediately after feeding because they can have acid reflux. It's going to increase their chances of having aspiration. So give their food time to digest. 60 to 90 degrees while being fed. Take them back a little bit so that they're comfortable for about 30 minutes to give the food time to digest. And then after that, if they don't have any distress, any signs of aspiration, that is when you'd be able to lay them flat. Hey family, guess what? We are this close to having 1 million, 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. Let's go to our next question, team. Hey. All right, so question number 11. Which of the following is the nurse aide's responsibility when caring for a resident with a urinary catheter? What's a urinary catheter? It's that thin, flexible tube that we the nurses insert through the urethra, and it drains the bladder. So if your patient has a catheter, you did not insert it, but you are responsible for doing one of these. Would it be A, reposition the catheter inside the bladder, B, clamp the catheter when the bag is full, C, keep the drainage bag below the level of the bladder, or D, disconnect the catheter for bathing? That's right, we have to give her a bath. We don't want her getting into the tub with a catheter. The answer is not D, you all. I was joking. All right. So if somebody has a catheter, they're not getting into a sit-down bath. They will probably have a sponge bath or they will be showered. So everybody, question 11, the correct response is going to be exactly what you have. It is C. You have to keep the drainage bag below the level of the bladder. That ensures proper drainage and reduces the risk of backflow, meaning urine going back into the bladder and infection. All right, you all, the sound you hear is my son coming in from playing soccer. So son, shh, quiet. All right, question 12. A resident with Parkinson's disease is walking very slowly and has a shuffled gait. The CNA should A, encourage the resident to walk faster to improve circulation. B, walk behind the resident with the wheelchair in case of falls. C, tell the resident to sit down until physical therapy arrives. Or D, use gentle prompts and offer support with a gait belt. All right. Let's see what my team members have. I love working with you all. Thank you for working a shift tonight at Nurse Eunice's nursing home. I appreciate you. And so for question 12, if you chose D, you have it. Let's see. Parkinson's disease affects mobility and balance. So the CNA should provide gentle guidance and use a gait belt to ensure safety without rushing or discouraging independence. All right, question 13. Which of the following examples best shows the CNA respecting the resident's legal right to make choices? Would it be A, offering the same breakfast tray every day for consistency? B, allowing the resident to refuse a shower and offering alternatives? C, dressing the resident quickly to stay on schedule? D, explaining the rules and expecting full cooperation? Or E, none of the above? That was a lot. So I'll give you about 10 seconds for that one. Oh, we are torn between D's and B's. I can't believe I tricked you all. 5 more seconds, you all. Think about it. Which one shows that the CNA is respecting the resident's right to make choices. It would not be D because we don't expect full cooperation. We don't own these patients. So that's right. If you chose B, you have it. So they get to participate in their care. They have the right to refuse care. And if your patient does not want a bath at noon, you would ask them when is another time that they would like a bath. When can you come back again? So the CNA should respect their choice and offer alternative times or options. Don't forget to document and don't forget to notify your nurse. Question 14. A resident with a new colostomy is embarrassed. What is the CNA's best response? A, avoid eye contact and complete care silently. B, tell them it's not a big deal. C, joke and lighten the mood. Or D, acknowledge their feelings and offer support. All right. And so when these patients have a new colostomy, they're going to have body image disturbances. This person was normal yesterday, and now they have a stoma. They have their intestine coming out of their skin with fecal matter coming out of it. So imagine how you would feel if you had a major life change overnight. And so, yes, you want to do D. Whenever we talk about communication, you as a CNA, it's more about you listening than you talking. So acknowledge their feelings. That's going to help promote emotional well-being and trust. Question number 15. A resident repeatedly refuses to participate in group activity that they used to enjoy. What do you do as a CNA? Is it A, inform the activity director and document the change? B, try to persuade the resident to attend anyway? C, skip the resident's activities for the rest of the month? Or D, tell the nurse the resident is being non-compliant? And so this is more like a nursing home or a group home. This is not hospital level. Usually if they're participating in a group activity, it could be bingo. And so Mrs. J used to love bingo, and now she's not going. What are you going to do? I see a lot of people saying that she's being non-compliant. You all, why would a person switch their behaviors, especially if they're elderly? If they used to enjoy something and now they don't do it anymore, what is that a sign of? Put it in the chat. It's not that she is being non-compliant. What's happening with her? That's right, Tanaka. You all, she may be depressed. So it isn't D that you're going to notify the nurse because she's being non-compliant. You can try to do B, but the correct response for this one is that activity director, you want to make them be aware, and you can also notify your nurse because that change, if we actually pay attention, she's probably not eating or drinking as much either. So when they activities, they won't eat, they won't drink, which puts them at risk of being malnourished and also dehydrated. So do report it, but they're not being non-compliant, they're being human. All right, so the answer was A, changes in mood or interest can signal depression or illness. Informing the activity director and documenting is the appropriate action. Question 16. Which action besides repositioning every 2 hours helps to prevent pressure ulcers in a bedridden resident? Is it A, massaging red or purple areas to stimulate blood flow? B, using baby powder to reduce moisture on all pressure points? C, tightly dry at all times. Of course, we know that we're going to turn our patients every 2 hours, but there are other things we can do in addition to frequent repositioning to decrease pressure sores. And what do you think, teams? Let's see what our team members say. We are torn between D's and C's. And you know what? You're both right. I didn't even catch C. That's right. We don't want our residents laying on wrinkles, but we most definitely don't want their skin wet. So D is the better option, but C, if you chose C, you weren't far behind. So I give you credit for that one too. That's why we say that you have to provide incontinent care promptly. We don't leave our residents wet. Wet skin, actually, wetness erodes the skin and it can cause the skin to break down and lead to initially like a rash. And then a stage 1 would be the redness. It can start opening and blistering. That would be a stage 2. So clean your patients as soon as they have an episode of if they urinate or if they become wet. Question 17. If a CNA is unsure on how to perform a procedure, what should they do? A, guess and try their best. B, skip it until someone else can do it. C, ask the nurse for clarification. Or D, ask the resident how to do it. Hey, Miss Eunice, I don't know how to use your wheelchair. Will you show me how to use it? That would be a recipe for disaster. So that's right, Danica, Ebed, Danita, Fatmata, you have it right, Lois. Afua, I hope I pronounced that correctly. It is C, y'all. Get that nurse to show you how to do it. Never perform a procedure that you're untrained or unsure about. And I know we want to trust our patients and we want to ask them for help, but the best person to ask for help is going to be that nurse, okay? All right, question 18. Before feeding a resident who has had a stroke, the CNA should A, check which side of the body is affected, B, place the resident in a reclining position, C, feed as quickly as possible, or D, offer large spoonfuls to save time. All right. I think some of you all are not on question 18 because of a delay, depending on what platform you're on, because right now we're streaming on Facebook, YouTube, and probably another platform that I can't think of, LinkedIn. And so question 18, is the response A, B, C, or D? And for everybody who is putting A, you are right. We need to know what side they had their stroke on, because if the left side of their body is affected and you put the food on the left side of their mouth, they're going to aspirate, or the food's just going to come right back out of their mouth because they're drooling. So you need to understand that deficits such as hemiplegia, one half of the body being paralyzed or weak, is going to cause aspiration if you put the food on the weak side. So make sure if you have a stroke patient, that you understand which is their weak side, and instead you want to utilize a spoon and feed them on the side that is not affected by the stroke. Question 19. The CNA is providing foot care to a diabetic resident. Which action is correct? A, clip the toenails with clippers. B, apply lotion between the toes to prevent dry skin. C, soak the feet in hot water. Or D, dry thoroughly between toes. All right, diabetics. Why is foot care important with diabetics? So once you give me the correct answer, I want you to tell me why we are so concerned about diabetic foot care. For everybody who chose D, your nurse just went, wow, your nurse is so proud of you. Now follow it up. Why are we so concerned about diabetic foot care? What is special about your diabetics and their feet? You never hear us talking about diabetic hand care, diabetic hair care. So what is so special about diabetic foot care, and why do we have to monitor their feet so carefully? Yo, T Young says, takes injuries a long time to heal. That is right. Joseph said it prevents wounds, and Miss Bonita says it can cause an injury or an infection. So when those diabetic patients, whenever they have an injury, yes, they are slower to heal. They have poor circulation. So on top of that, they may not feel it if it's injured. Mercy? Yay! That is right. So everybody, I'm so proud of you all. Let's go to the next response. Take care of our diabetics and their feet. And even if they live in Florida, they're not supposed to wear flip-flops. They're supposed to have on good shoes. Question 19, the answer was D, which you all chose. Question 20. The most important reason to bathe a resident regularly is to A, remove germs and promote health. B, make them smell good. C, keep the skin dry. Or D, follow a routine. Your patient didn't urinate on themselves, they didn't poop on themselves, and your nurse is like, hey, he gets a bath. If they're in like a residential type facility, he gets a bath every Monday, Wednesday, and Friday, or they may have their shower days. And you're like, but he's clean. Why are we asking you to go bathe this resident who doesn't stink? And if you chose A, that's right. We need to remove those germs. Even though he doesn't stink today, those germs are still there. Believe me, I hate to be nasty, but when he passed gas, he let out a little something when he passed gas. So it could be a little wetness down there. We need you to bathe them up, okay? That's going to help them stay clean. It's going to also allow you to visualize their skin so you can notify the nurse if you see any breakdown, a rash, a bruise. So bathing is important. Question 20. 1. A resident refuses to eat the meal provided. I'm not eating that. What is the CNA's best response? A, notify the nurse immediately. B, try to force a few bites. C, ask why and offer an alternative if available. Or D, ignore the refusal and remove the tray. Well, if he don't want to eat, I'm just going to take the tray out. That's going to be him starving. Don't be that CNA. All right, so for question 21, team, what is the best response? We are torn between A's and C's. And so if you go out and you tell the nurse, hey, he refused to eat, the nurse is probably going to ask you, well, what did you do after he refused to eat? So we typically, if the patient's not violent, if they're not cursing you, trying to harm you, we don't accept the first refusal. We try to figure out their why. So the answer's going to be ding, 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 C. Why don't you want to eat? Because my stomach hurts right now. Maybe I will eat some soup if you have that. So exploring the reason and offering options supports resident autonomy, their right to make decisions about their health while also maintaining their nutritional status. Question 22. I forgot. You all know what I asked for. And so you all help a nurse out. If you've stayed this far, if you've stayed for this long and you haven't liked this video, shared this video, or subscribed to our channel, look, you all, we are 48,000 subscribers away from receiving our Gold YouTube Award. And so we do that because of people like you. So we appreciate your support. We come on here at least twice per week to help you pass your test. And all we ask for is a like, a share, and maybe a cup of coffee when you go to nurseeunice.com. All right, question 22. Which action demonstrates, hold up. Congratulations. You are so welcome. I'm so proud of you. Congratulations on passing your test. And then Andrea, thank you for the hearts. All right, so everybody, which action demonstrates the correct use of a mechanical lift or Hoyer lift during transfers? Would it be A, removing the sling once the resident is lifted off the bed? B, keeping the resident's arms free and legs crossed? C, locking the lift's wheels during the entire transfer? Or D, ensuring at least 2 trained staff members are present? Thea, Miss Lane, Rebecca, you all were fast with this one. Look, I don't care how short-staffed your facility is. You will never, ever, ever, ever transfer a patient in a lift, a mechanical lift by yourself, because you're going to go to jail. That patient may fall and the facility's going to say, we taught her better. She just was in a rush and she did it by herself. So one person actually keeps a hold of the patient who's in the lift, and the second one operates, it's like a crane. They operate the actual machine. So if you don't have help, you need to wait. The patient is safer in the bed than with you operating a lift all by yourself. Question 23. You are asked to assist with postmortem care after death, postmortem after death care. Which of the following actions is most appropriate? A, immediately remove the resident's dentures and discard them. B, close the eyes and mouth gently and position the body respectfully. C, leave all personal items on the body for the family to remove. Or D, delay care until the resident's roommate leaves the room. Yep. Some of your facilities still have semi-private rooms, which means it could be 2 people in the room. But what would you do? And this specifically refers to post-mortem care after death care. So it wouldn't be D, because if a patient was, actually dying in a room, more than likely we would not keep the roommate in that room. That would be traumatizing for that poor roommate. So the answer is not D. Revealing the correct response in 3, 2, and that is right. It is going to be B, you all. Post-mortem care includes positioning the body respectfully and preserving dignity. Dentures are usually reinserted, so we need to put those dentures back in their mouth before the rigor mortis sets in. And so if you all don't know, the reason why we take the dentures out of the mouth during the code is if the patient needs to be intubated and the false teeth are in their mouth or their dentures are in their mouth, we can actually break off one of those and they end up in the patient's airway. So usually in an emergency, we have to do something like bag or intubate. Dentures are out. If we could not resuscitate that patient, you have to then put those items back in. And so I want to go back and show you this. We have a full clinical video playlist on YouTube. You can access it from going to our website, and you'll see a tab, blue button up top to the right, that says clinical skills videos. But if you want to learn how to perform postmortem care, I have 2 videos on that. And yes, as a CNA, as a new CNA, you would be responsible for assisting and taking care of someone after they died. So it will be a good video for you to watch. Question 24. A resident suddenly complains of new leg pain, swelling, and warmth in one calf. What should the CNA do? A, massage the leg to improve circulation. B, assist the resident to walk it off slowly. C, elevate the leg and apply heat. Or D, report symptoms to the nurse immediately and avoid movement. Ouch, Mazan, my leg hurts and it's swollen. Will you massage it? That's right. The answer is absolutely no. We will not be massaging a painful calf. You're going to elevate it. You're going to limit movement, and you're going to get that nurse into the room, because those are signs of deep vein thrombosis or DVT. And if they travel, it could be life-threatening. The patient could stop breathing if it goes to their lungs. So movement should be avoided. The nurse should be notified, and then you will follow the nurse's direction from there. Question 25. A CNA should wear gloves when? And this one's tricky. Is it when you're making an unoccupied bed, when you're feeding a resident lunch, when you're performing perineal care, or when you're talking with a resident? And so regardless of which test you're taking, which of these is the most contaminating? That's how I want you to read this question. I should wear gloves when I'm performing the most contaminated skill, because I know some of you are like, I want to wear gloves with everything. That's not going to be a response on your test. That is right. It is going to be C. C is the most contaminating. And when you're taking your CNA examination, check with your instructor. But for most of the feeding skills, gloves are not required. Clean hands are, but gloves are not. Now, if you're in a hospital, that means you have your CNA license already. You do whatever you need to do to protect yourself and to protect your patient. All right, so question 26, which system is responsible for detecting pain, temperature, and pressure? So which body system? Is it the immune system, the integumentary system, the endocrine system, or the lymphatic system? This one's tricky, Anne-Marie. This one's tricky, Ebed. Miss Benita, this one's tricky. So everybody's giving me C. It's not C. Danita has it. She's the first one who put B. So think about it. When you're cooking in the kitchen, and you touch that hot stove, ouch. Your skin detects pain, temperature, and if you lay on one side too long, it's going to be uncomfortable. You're going to feel uncomfortable. You're going to feel some pain. So, everybody, B, the integumentary system we're referring to is the skin. So, the skin contains sensory receptors that detect environmental changes like pain and temperature. Question 27. A resident is experiencing mild anxiety. Which action should the CNA try first? Is it A, encourage deep breathing and a quiet environment? B, suggest medication to the nurse? C, ask the resident to nap immediately? Or D, ignore it unless it becomes worse? Your patient's becoming anxious. They have mild anxiety. That's right. And so how would we practice that? All right. So Miss Lucas, it appears as if you're becoming more anxious. How are you feeling right now? I'm just so worried. All right, Miss Lucas, let's take some deep breaths in and out. Breathe like me. Let's take a deep breath in and release it. And then try to, just make the environment quiet. Maybe put on music instead of Maury Povich or something crazy on TV, but that will help decrease your patient's anxiety level. So great job, team. Question 28. A resident is found masturbating in their room. The CNA should A, yell at them to stop, B, report them for inappropriate behavior, C, close the door and provide privacy, or D, call their family immediately. Patient is masturbating. What are you going to do? That's right. You should have knocked to begin with. So, Nayo says, LOL. You all, these are adults and they have adult emotions and adult needs. Just because they're in your facilities, you don't own them. So the answer is going to be C. Masturbation is a normal behavior. So first of all, knock before you go into their room and give them an opportunity to say, come in. You're going to respect their privacy because they're paying for that room. It is theirs. And again, you don't own them. Plus, you don't want to see that. So give them time. Knock on the door before you enter the room. Question 29. A resident complains of constipation. What is an intervention within the CNA scope of practice? The LPN has a scope of practice, the RN has a scope of practice, and you, as a nursing assistant, have a scope of practice also. So are you able to do A, give a laxative, B, give a suppository, C, perform a digital rectal exam, or D, encourage fluids and increase fiber-rich foods if allowed? All right. I see all these correct answers. Somebody put C. I don't know who that person was. Don't do that. It is not C. The correct response is D, but I need to know more. Give me an example of a fiber-rich food. We're telling you to go do something. What are you going to pick from the pantry? I want you to imagine that anything that you put in that chat is available in the pantry or the refrigerator. Tell me one fiber-rich food. Man, Miss Benita, you just showing out, girl. We're going to give them some prunes. That is right. And we got prunes. We got oatmeal. You all are so freaking awesome. Apples. So yes, those answers are all correct. You should be so proud of yourselves. I'm proud of you. So it's going to be D. CNAs can promote hydration and offer high fiber meals per the care plan to support bowel regularity. Don't forget that if you just give them fiber, but you don't give them any water, you bulk up the stool, but the water helps flush out the bowel. So they need both. They need the prunes, the apples, the oatmeals. All that just sounds like you're going to be really regular, but also give them some water too. Question 30. What does incontinence mean, team? Is it A, the inability to hear, B, being incoherent, C, the inability to urinate, or D, the loss of bladder or bowel control? What does incontinence mean? Angelica, Darlene, Andrea, Rebecca, Mrs. Love, Child of God, you have it. So your patient can have urinary or fecal incontinence. So the answer is D. Incontinence is the loss of control over urination or defecation, aka fecal matter. And the CNAs often provide care related to this condition. Whenever you take your test, don't forget that a CNA does not insert a catheter. A CNA does not insert anything internal, so no suppositories, none of that. But what you do is you take, that did not sound right, what you do. What skill you do perform is you would take your residents to the bathroom more frequently, or you would offer that bedpan more frequently. You all, I apologize for my Freudian slip right there. But question 31. Which behavior supports a resident's rights? I know, Tanaka. Would it be A, allowing a resident to refuse therapy, B, limiting phone calls to reduce noise, C, repositioning a resident only once per shift, or D, withholding meals for non-compliance? We have to support those residents' rights. They have rights. So which of those options helps to support and give them autonomy, allows them to make decisions for themselves so they feel like they're in control? And yes, this should be super easy for you all. It is A. And so whenever you are supporting your resident, hey, I hope you're still there. My computer just did something crazy again. Oh. Hey, I'm saying, hopefully y'all can still hear me. If you can hear me, give me a thumbs up. So it took me a while to actually get online because I was having Wi-Fi issues. And so I just want to make sure you all can still hear me. All right. I see everybody giving the correct response. Can you still hear me? Thank you. Thank you. Thank you. So yes, it's A. Residents have the right to refuse treatment, including therapy and medication, but you can try to persuade them gently. Question 32. The first step in proper hand washing is, and a lot of you all get this wrong. So when you're taking your CNA exam, I'm going to hide this. I don't even want you looking at the question. When you're taking your CNA examination, the fastest way for you to fail your clinical skills is for you to mess up on hand washing. So when you're studying all those other skills, you should be practicing hand washing the way that your instructor taught you how to do so every day. And don't forget, we wash our hands before and after patient care. So for most of your skills, you're washing your hands twice. All right, with that being said, the first step in proper hand washing is A, wetting hands and wrists with warm water, or B, do you apply your soap first? C, dry with a paper towel first, or D, rub hands for 5 seconds. What's the first step whenever you are washing your hands? Especially when you have a nurse in front of you with a clipboard who's going to help determine whether or not you pass or fail your CNA skills test. That's right. All right, so it looks like Maka says you wet those hands first. So everybody, the answer is A. For those of you who are choosing B, apply soap first. Guess what happens when you wet your hands if you apply soap first? Your soap goes down the drain. So it's always wet hands first, apply soap second, and then 3, you start lathering, you start cleaning your hands. All right, so again, the correct response for that one would be A. And Ba Fatima said A. That is right, wet them first. Question 33. All right, so Claire wants to know who's learning from Uganda. Hey, welcome, Claire. I don't even know what time it is in Uganda. I'm in Florida. So everybody, if you want to put where you're viewing from in the chat, I think this is a good time to do so. But which term means difficulty swallowing? Is it dyspnea? Is it aspiration? Is it dysphagia? Or is it contracture? So I have multiple videos on medical terminology, multiple videos on prefixes and suffixes. So I need you to break those terms down. Which one means difficulty swallowing? What is the prefix for something that's painful or difficult? And Yvette's watching from Tampa. So everybody got it right. Oh my God, you all are awesome. It is C. That's right, because DYS in front of any medical term. Remember, if it's in the front, it's called a prefix. In the back, it's a suffix. So DYS stands for difficulty or with pain. So dysphagia, or excuse me, let me make sure I say it right. Dysphagia is difficulty swallowing, which increases the risk of aspiration. CNAs must monitor residents with this condition during meals. It differs from aspiration because aspiration is the medical term for when food or fluid accidentally go into the airway. It goes into the lungs. So let's go back and let's see where you all are watching from. Samuel, I don't speak. I think that is Creole, so I'm sorry. Thea's watching from New York. Nay Fitness is also watching from Brooklyn. Kay is watching from Ohio. Alpha from Afua from Canada. T Young is from Jacksonville. Duval, I hope it's Duval. Hope it's Jacksonville, Florida. We have somebody from Maine, Houston, Michigan. Oh my God, you all from all over. I love you and thank you for being with us. Question 34. The resident has an indwelling catheter. London. Oh my God. Yes, it's so. Samuel, why were you going to type that in Haitian Creole knowing I'm from Duval County? I'm from Jacksonville, Florida. I can't read that. All right. So the resident has an indwelling catheter. The CNA notices urine leaking around the tubing. So your patient who has a catheter is wet. What do you do? Is it A, reinsert the catheter, B, report the observation to the nurse, C, clamp the catheter, or D, increase the resident's fluid intake? Looks like Thea and sure no. I think that's sure no. Angelica, Mona, looks like Fatmata, Mavis. All right, so a lot of people say B, and you're absolutely correct. So if they have a catheter and it's leaking, maybe it's not draining properly. Maybe someone lifted the bag above the level of the bladder, which caused backflow. But after you make sure there's no kinks, you need to be reporting that to the nurse because any catheter complication must be reported for proper evaluation. Question 35. What does the term fecal impaction mean? Is it A, rash around the rectum, B, bleeding during the bowel movement, C, frequent loose stools, or D, hardened stools stuck in a rectum? And hopefully your patients never have a fecal impaction, because if they have a fecal impaction, that means that you nor the nurses were doing their job. We have more than just vital signs. You go into the room, yes, you get the blood pressure, the pulse, the temperature, and respiration. You're also going to ask, hey, when's the last time you urinated? And how are your bowels? How's your pain? Those are just general questions you want to ask your patients every shift. And if that patient says that they haven't had a bowel movement in 1 or 2 days, usually 2 days is about the max. They haven't had a bowel movement, that means constipation. Fecal impaction means that it's so hard until we can't give them a laxative. We can't give them a suppository. They literally have a brick of crap in their colon. The nurse would have to put on gloves, lube up the fingers, try to manually with her fingers remove that hard stool. And if we can't get it out that way, the patient has to go to surgery. So ouch, 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 and ouch again. So don't forget your vital signs. After you get through doing those basic vital signs, ask about pain, ask about urination, and also ask about their previous bowel movement. All right, so question 35, of course, we know the answer is D. Question 36, which term describes urinating at night? Is it nocturia, polyuria, anuria, or hematuria? Look at all those prefixes. Go, go, go. Do you know what those prefixes, what they mean? What poly means? What noct means? What a in front of a word means? What hema in front of a word means? And so for this one, if you chose, that's right, like an owl is nocturnal, they're awake at night. The term that describes urinating at night is going to be nocturia. It's going to be A. So it is the need to urinate frequently during the night, which can disturb sleep and leads to falls if not managed safely. So let's piggyback off of that one because you all did so well. A resident with nocturia gets up multiple times during the night to use the bathroom. What is the best action the CNA can take to promote safety? Is it A, turn off all lights in the room to encourage sleep, B, offer the bedpan every hour without asking. C, make sure the call light and night light are within reach. Or D, withhold fluids in the evening to reduce bathroom trips. And y'all, my fingers are crossed. Do not choose D. If you choose D, that is neglect and you may be going to jail. We only restrict fluids with a physician's order. And so if you don't have a physician's order, you cannot treat these adults like they are your toddlers and start withholding their fluids. So I know you didn't choose D. Give me the best answer that's not D. Hey family, guess what? We are this close to having 1 million, 1 million subscribers, and we can do it with help from you. So what do I need you to do? I need for you to hit that subscribe button. Look, you've already been watching our content. We need for you to make it official. Hit the subscribe button. Join the Florida Training Academy and the Nurse Eunice family. All right, you all, you have it. It is going to be C. So residents with nocturia are at a higher risk of falls during nighttime bathroom trips. And a lot of your facilities have motion activated night lights where as soon as they move their foot or something, the lights under the bed, if they're not automatically on, they will come on. So ensuring the call light and night light are within reach helps the resident safely ask for assistance and navigate the room without tripping. What can you put at their bedside? If your patient has nocturia and they agree to it, what can you put at their bedside to make going to the bathroom easier at night and to reduce the risk of falls? Put it in the chat. Remember, our job is to be proactive. We see Miss Lucas getting up to the bathroom 3 or 4 times. Do we really want her walking all the way to the bathroom? What can we put at her bedside? Diana has it. We're going to put the bedside commode next to her. Yes, for safety. Great job, Diana. Question 38. A resident with dyspnea becomes short of breath after walking a short distance. What should the CNA do first? A, encourage the resident to walk faster to build endurance. B, instruct the resident to lie flat on the bed. C, call 911 immediately. Or D, help the resident sit down and rest. So, what does this patient have? They have dyspnea. Remember DYS in front of a word? That stands for difficulty. So this person already has difficulty breathing. Put it in the chat. What conditions cause difficulty breathing? Like, give me some lung conditions. Go ahead, put them in the chat. Because you don't have to call 911 unless the patient's like turning cyanotic or something. So what would be a reason that a person would be short of breath, but it would be normal for them to be short of breath? We have asthma. We have a lot of people who chose asthma, and then they chose COPD. That is right. So everybody, some people have chronic lung issues. Do D, give them a chance to sit down and to take deep breaths in and out. And if that doesn't improve or if they worsen, that is when you call 911 if you are in a home care setting. But if you're in a hospital, of course, you're going to press that code button or call for that nurse to get into the room. So the CNA should assist the resident to sit up in an upright position to rest and ease breathing. Sudden shortness of breath needs to be reported to the nurse, but emergency services are not called unless the condition is acute and life-threatening. And then Claire said heart failure. Vivian said heart failure. You all, oh my God, I'm so proud of you all. That is right. Remember, if the heart isn't pumping, those fluids are going to back up. So CHF does cause the person to have dyspnea also. Question 39. You notice that a resident's socks are leaving deep marks on their ankles and the feet appear swollen. My favorite CNA that I love working with, girl, we be having so much fun together on our 12-hour shift. What are you going to do? Are you going to do A, are you going to cut a slit in the socks? Are you going to do B, elevate the feet? Are you going to do C, ignore it unless the resident complains? Or are you going to do D, give the resident more salt to reduce swelling? And if you can see my little happy nurse tears over here, I'm so happy because you all make me happy because you're great caregivers. No one cut the socks. I know you wanted to, but that wasn't the right answer. All of you all elevated the feet. And don't give them salt. We know that fluid follows salt. So if they have a lot of salt, they're going to swell more. So swelling, aka edema, must be reported to the nurse. But while you're in the room, before you can get me, you're going to make sure that the feet are elevated, especially if it's part of their care plan. CNAs cannot apply medical compression garments or alter the diet without direction. You all, we made it to the end. We're on question number 40. And you know, I am sad. I hate leaving y'all, but a sister got to get a nap at some point in her life. So question number 40, everybody. Which situation requires the CNA to complete an incident report? Is it going to be A, the resident's dentures are missing during morning care? B, a resident becomes confused about the date? C, a resident requests a different CNA for tomorrow. Ooh, she ain't like you. Or D, a resident's daughter brings outside food. So the videos are on our playlist. So all you got to do is, if you're not, it looks like you're on YouTube. So all you have to do is, you can save it by clicking the 3 dots and usually be like save video or add the playlist. But we have a full playlist of CNA practice questions on our YouTube channel. And you can also access that from our main website, which is fltraining.com. So thank you for liking our videos and wanting to come back and watch it again. All right, everybody. So which one is so bad that we have to write it up? That's right. Hey, do not lose those people's dentures, y'all. Y'all don't lose their dentures. So if you go into a room and you can't find dentures, you can't find a hearing aid, we need to put everybody needs to be on the lookout. You check the trays, you check the gowns, you check the trash. Because if we cannot locate those dentures, your facility is responsible for replacing them. And they are super expensive. So lost or damaged personal items like dentures must be reported and documented in the incident report to remain accountability and transparency. But before it ever gets to that incident report, we're going to tear that building down. We're going to be looking for those dentures. We're calling dietary and making sure they don't, go on the trays. So as a good CNA, that's part of your job. When you go into that room, you should know whether